Welcome to the start of your Home Health Aide certification journey. In this lesson, you'll learn what the HHA exam is, why it's required, and who needs to take it. Whether you're just starting out or exploring a career in home healthcare, understanding the purpose of the exam is your first step toward becoming a trusted and certified caregiver. What is the HHA exam? Purpose of the HHA exam. The Home Health Aide HHA exam is a certification test that evaluates whether a candidate is prepared to safely and effectively provide basic home health care services. It ensures that the candidate understands core skills, patient rights, infection control, and basic personal care. The exam is required in many states to work in Medicare or Medicaid-certified home health agencies. Let's talk about what the exam measures. The exam evaluates both knowledge and caregiving ability. It typically includes a written or oral exam with multiple choice questions, a skills demonstration, hands-on practical test. The topics covered usually include personal care, such as bathing, grooming, and toileting, nutrition and meal preparation, basic infection control, vital signs and basic observation, communication and documentation, safety and emergency procedures, mental health and emotional support. Let's explore the format and variations of the HHA exam. Depending on your state, the HHA exam may be administered by state-approved training providers, home health agencies, community colleges or career schools. Some states follow federal guidelines, minimum 75 training hours and a competency test, while others have state-specific requirements. Who needs to take the HHA exam? Entry-level caregivers. Most individuals taking the HHA exam are new caregivers who want to become certified home health aides. Certification is typically required to work in Medicare or Medicaid-funded home health agencies, state-regulated or licensed private home care providers, certified nursing assistants, CNAs. CNAs may take the HHA exam or complete a short bridge program to qualify as an HHA. Many CNAs pursue HHA certification too. Expand job opportunities, work independently in home care settings, increase pay rate. Personal care aides and family caregivers. In some states, personal care aides, PCAs, or family caregivers may seek HHA certification to work through formal agencies. Certification may also be used to qualify for state-funded caregiver reimbursement programs. Job settings that require certification. Certified HHAs can work in private homes, hospice home care programs, community-based residential homes, long-term care programs that include in-home services. The Home Health Aide HHA exam certifies individuals to provide basic, compassionate care in a home setting. It evaluates both theoretical knowledge and hands-on caregiving skills. Core topics include personal hygiene, nutrition, safety, infection control, and patient communication. Required for working in Medicare or Medicaid-funded home health agencies, and often by private employers. Ideal for new caregivers, CNAs expanding credentials, or anyone entering the home care field. Passing the HHA exam is a key step toward a rewarding, secure career in the rapidly growing healthcare sector. In this lesson, we'll break down the two main parts of the HHA certification exam, the written test and the skills evaluation. Knowing what to expect on each section will help you prepare with confidence. Whether you're reviewing multiple choice questions or practicing real-world care skills, this overview will guide you through the exam structure and help you understand how each part is scored. The Home Health Aide HHA exam is divided into two primary parts. Written or oral exam. Test your knowledge of theory and caregiving practices. Skills evaluation. Assesses your ability to safely and correctly perform hands-on caregiving tasks. Most candidates must pass both parts to earn their HHA certification. Let's take a closer look at the structure and format of the written or oral exam breakdown. Structure and format. usually consists of 50 to 100 multiple-choice questions. Some states or agencies may offer an oral version for candidates who have reading challenges or prefer to hear questions, typically completed on paper or a computer, depending on the testing center. Topics covered. The written portion assesses your theoretical knowledge of caregiving duties. Topics usually include personal care, bathing, toileting, grooming, dressing, basic infection control and universal precautions, nutrition and food preparation, body mechanics and safe transfers, communication skills and reporting changes, basic anatomy and physiology, mental health and emotional support, patient rights and confidentiality, emergency procedures, for example, what to do if a client falls or has difficulty breathing. Here are a few examples of the types of questions you might see on the written portion of the HHA exam. Which of the following is the best way to prevent the spread of infection? This question tests your understanding of proper hygiene and infection control procedures. What should a home health aide do if the client refuses to eat? This assesses how you respond to common caregiving challenges while respecting client rights. When assisting a client to walk with a cane, which side should the aide stand on? This focuses on safe mobility practices and correct support techniques. When it comes to scoring, you typically need a minimum passing score of 70 to 80% depending on your state or training program. Results may be available immediately or within a few days after the test. If you fail, you may be allowed to retake only the failed section, depending on your state rules. Let's walk through what to expect during the skills evaluation portion. Purpose and format. The skills portion tests your ability to perform caregiving tasks in a safe and professional way. You'll demonstrate your skills on a live volunteer, a person or mannequin, in front of a test evaluator. You'll usually be asked to perform 3 to 5 randomly selected skills from a standard list. Common skills tested. Here are some of the most frequently tested skills on the HHA exam. Hand washing, always tested first. Measuring vital signs, temperature, pulse, respiration. Transferring a client from bed to wheelchair. Providing perineal care. Assisting with ambulation using a gait belt. Making an occupied bed. Providing mouth care or denture care. Feeding a client. Recording intake and output. Helping with a bedpan. You are graded on both accuracy and safety, including proper technique, respect for patient dignity, use of gloves and hand hygiene, communication during care, following procedure steps in order. Now let's talk about how your skills evaluation is scoring. Most states use a pass, fail grading system for each skill. You may fail the entire section if you skip a critical step, e.g. hand washing or safety precautions. A second attempt is usually allowed if you don't pass on the first try. Let's go over what you can expect on the day of your HHA exam. Arrival and setup. Arrive at the test center early with your ID and required documents. Wear scrub-like or professional clothing. Some states require this for skills testing. Bring any materials the program instructs you to bring. Follow instructions carefully. Talk only to test staff. It's completely normal to feel nervous before the skills test. Many candidates do. But don't forget, you're not being judged on perfection. You're being evaluated on whether you can provide safe and respectful caregiving. And here's the key: practice helps. Review each skill multiple times before your exam to build confidence and reduce stress. With preparation and a calm mindset, you'll be ready to succeed. Here's a quick recap of what we've covered about the HHA exam. HHA exam includes a written/oral test and a skills evaluation. Written test: 50 to 100 multiple-choice questions on basic home care topics. Skills test: perform tasks like vital signs, feeding, and mobility assistance. Hand washing is always tested and must be done correctly. Must pass both parts to earn certification. Candidates are scored on accuracy, safety, and proper steps. Preparation boosts confidence on test day. In this lesson, we'll go over some of the most common mistakes that cause test takers to lose points on the HHA exam, both in the written and skills portions. Avoiding these simple but critical errors can make the difference between passing and needing to retake the test. From misreading questions to forgetting key steps during hands-on demonstrations, we'll walk through what to watch out for and how to stay calm and focused on test day. Let's start with one of the biggest mistakes candidates make on the written exam: misreading the question. A major reason test takers miss questions is that they rush through reading and misunderstand what is being asked. Many questions are scenario-based, so it's important to read carefully and focus on keywords like first, best, most important, or next step. Strategy: underline or mentally highlight key parts of the question and eliminate clearly wrong answers before choosing. Another common mistake is choosing based on personal experience. Some test takers answer based on what they did during clinicals or home training, which may not always match standard procedure. The exam is based on textbook safety and guidelines, not personal shortcuts. Strategy: always choose the most correct, safest, and most respectful answer, even if it's different from how you saw it done. Guessing without eliminating answers. Random guessing can lower your chances of selecting the right option. Strategy: eliminate obviously wrong choices first, then make an educated guess. This increases your chance of picking the right answer from 25% to 50% or more. Not managing time. The written test usually allows plenty of time, but rushing or overthinking can cause mistakes. Strategy: pace yourself and flag difficult questions to come back to later. Now let's review the most common mistakes that can happen during the skills portion of the HHA exam and how to avoid them. Skipping hand washing or infection control. Hand washing is one of the most failed steps, and it's often the first skill tested. Forgetting to wash hands at the right times or not washing long enough can result in automatic failure. Strategy: always wash your hands before and after patient contact and use proper technique: 20 seconds, friction, rinse, dry, turn off faucet with paper towel. Performing skills out of order. Most caregiving tasks must be done in a specific sequence to ensure safety and efficiency. Performing a skill out of order, like feeding before checking food temperature, may be considered unsafe. Strategy: practice each skill in step-by-step order, using a checklist until it's automatic. Not providing privacy or respect. Forgetting to knock, introduce yourself, or pull the privacy curtain may lose you important points. Strategy: always follow professional protocol. Treat the client or mannequin with the same respect as a real patient. Not communicating with the client. Silence during a skill may be marked as lack of care or poor patient interaction. Strategy: always explain what you are doing, even if you're nervous or it's a mannequin. This shows confidence and professionalism. Forgetting safety measures. Leaving the bed too high, forgetting to lock wheelchair brakes, or failing to lower bed rails after care are common mistakes. These are considered critical errors and may result in failure. Strategy: always finish each skill with safety checks. Call light and reach. Bed low and locked. Hands clean. Let's talk about common behavior-related mistakes on exam day and how to avoid them. Arriving late or unprepared. Being late or forgetting documents, like ID or exam confirmation, can prevent you from testing. Strategy: prepare everything the night before, arrive at least 30 minutes early, and dress in comfortable, clean clothing, scrubs if allowed. Showing anxiety or lack of confidence. Nervousness is normal, but freezing up, mumbling, or forgetting steps due to panic can hurt your performance. Strategy: practice until confident, breathe deeply during the exam, and move slowly and deliberately, not fast and frantic. Confidence doesn't mean being perfect. It means staying steady and focused, even when you're nervous. Not asking for clarification when allowed. On some written exams or skill stations, you may be allowed to ask questions if you're unsure of instructions. Strategy: don't be afraid to ask. If allowed, it's better to be clear than to guess and fail. To succeed on the HHA exam, awareness is key. Avoidable mistakes cause many HHA exam failures. Written test: misreading, bad habits, poor time use. Skills test: missed hand washing, safety, or communication steps. Other issues: being late, nervous, or unprepared. Tip: Practice with checklists, simulate the test, stay calm and professional. You're now one step closer to certification. Let's move on to the next lesson. Hand hygiene is the single most effective way to prevent the spread of infection in home healthcare. In this lesson, you'll learn when and how to wash your hands properly, the differences between hand washing and hand sanitizing, and the correct procedures for putting on and removing gloves. These simple but critical practices protect both you and your client from illness and contamination. Let's start with why hand hygiene is so important in home healthcare. Hand hygiene is the #1 way to prevent the spread of infection in home healthcare settings. As a home health aide, HHA, you care for patients with weakened immune systems, wounds, or chronic illnesses, all of whom are at higher risk for infections. Germs can live on hands for minutes to hours and are easily transferred between surfaces, equipment, and patients. That's why clean hands are more than just a habit. They're your first line of defense in protecting your clients and yourself. Let's take a closer look at the common germs spread by hands. Bacteria like E. coli, Staphylococcus aureus, viruses like the flu, COVID-19, and norovirus, fungi and parasites in certain care environments. These can be transmitted through direct touch, sneezing, coughing, or contact with contaminated surfaces. Now let's talk about when hand hygiene is required during your daily duties as a home health aide. Always wash your hands before and after patient contact, before preparing food or feeding a client, after touching blood, bodily fluids, or soiled items, after using the bathroom or helping a client use it, after removing gloves, after coughing, sneezing, or blowing your nose. So, which method should you use? It depends. Soap and water, when hands are visibly dirty after using the bathroom or when exposed to blood/body fluids. Alcohol-based hand sanitizer, when hands are not visibly soiled and a sink is not available. Take note. Sanitizer should be at least 60% alcohol to be effective. Let's go over the proper hand washing step by step. 6-step hand washing procedure. Wet hands with clean running water. Apply soap and lather well. Scrub all surfaces, backs of hands, between fingers, under nails, for at least 20 seconds. Rinse thoroughly under running water. Dry with a clean paper towel. Turn off faucet using the paper towel, not bare hands. Tips to remember. Use friction to loosen germs. Do not touch the inside of the sink. Always wash before gloving and after degloving. Avoid wearing long or fake nails. They harbor bacteria. Proper hand washing isn't just about going through the motions, it's about following the correct steps every single time to protect yourself and your clients. Let's talk about glove use, specifically when you should be wearing gloves during care. When there's a risk of contact with blood, bodily fluids, or broken skin. When handling soiled linens, dressings, or contaminated equipment. When performing tasks like perineal care, changing bedpans or diapers, cleaning wounds, handling trash or laundry. Let's go over the correct steps for putting on gloves. Wash or sanitize hands before putting on gloves. Choose correct glove size. Put gloves on carefully, avoid tearing. Make sure cuffs cover the wrist. Steps for removing gloves. Degloving. Pinch the outside of one glove near the wrist and peel it off. Hold the removed glove in your gloved hand. Slide ungloved fingers under the cuff of the remaining glove. Peel off the second glove, turning it inside out over the first glove. Dispose of both gloves in a proper waste container. Wash hands immediately. Let's look at common glove-related mistakes to avoid. Wearing gloves instead of washing hands. Touching clean surfaces with dirty gloves. Reusing or double gloving, not removing gloves between tasks or patients. Wearing gloves in public, cross-contamination risk. Hand hygiene in a home care environment comes with its own challenges, but your standards should never change. In home care, you may not have a full hand-washing station. Always carry hand sanitizer and disposable gloves. Have soap, paper towels, and alcohol wipes in your HHA kit. Educate family members about hygiene too if appropriate. Be creative, but strict about infection control, even in non-clinical homes. Let's recap the key points from this lesson. Hand hygiene is key to preventing infection. Wash or sanitize before and after every patient interaction. Scrub all hand surfaces for at least 20 seconds. Use gloves for tasks like wound care or toileting. Gloves must be put on and removed properly. Gloves do not replace hand washing. Always change gloves between tasks and patients. Proper hygiene protects you, client, and others. Remember, clean hands and proper glove use aren't just good habits. They're essential to safe professional care. See you in the next lesson. Welcome to this lesson on Standard Precautions and Personal Protective Equipment, or PPE. Standard precautions, also known as universal precautions, are a set of infection control practices used to prevent the spread of illness in any healthcare setting. These are applied to every client, regardless of whether they show signs of infection. Standard precautions assume that any blood, body fluids, except sweat, non-intact skin or mucous membranes, may carry harmful microorganisms, even if the client seems healthy. These precautions apply to blood, vomit, urine, stool, feces, mucous sputum, wound drainage. Always assume potential infection and follow standard procedures every time. When are standard precautions required? Standard precautions are required anytime there's a chance of contact with blood or bleeding wounds, vomiting or diarrhea, mucus or respiratory secretions, soiled clothing, linens, or equipment, medical sharps or injury risk, skin that is broken, peeling, or infected, clients with coughs, fevers, or known infections. This applies during changing linens, providing oral care, changing dressings, cleaning up spills or contaminated items, feeding or cleaning a client who is vomiting or has diarrhea. These precautions apply even when infection is not confirmed. Types of PPE. Personal protective equipment. PPE is used to create a physical barrier between you and any potential source of infection. It keeps microorganisms from reaching your skin, eyes, nose, mouth, and clothing. Common PPE includes gown, protects your clothes and skin from spills or splashes. Mask, covers your mouth and nose to prevent inhaling germs or spreading droplets. Goggles/face shield, protects eyes from sprays or splashes, e.g. during oral care or suctioning. When to use each type of PPE. Let's begin with the gown. When should it be worn? There's a chance your clothing may come into contact with body fluids, e.g. during diaper changes, wound care, vomiting episodes, assisting a client with diarrhea, incontinence, or open wounds, cleaning heavily soiled bedding or surfaces. Remove and discard the gown after each task or before moving to another room. Let's talk about when to wear a mask. The client has a cough, respiratory infection, or is under isolation precautions. Performing oral hygiene, tracheostomy care, or suctioning. There's a risk of splashes or sprays reaching your nose, mouth, vomiting, spitting, or respiratory droplets. A surgical mask is often enough. In rare, high-risk situations, special masks like N95s are used under RN agency guidance. When to use each type of PPE, goggles or face shield, providing care where splashes are likely, such as cleaning up vomit, suctioning a client, assisting with heavy coughing, providing oral or dental care. Goggles protect eyes from infection entry points. Viruses and bacteria can enter through mucous membranes. To use personal protective equipment correctly, there are a few essential rules you must always follow. Always put on PPE before contact with the client or contaminated surfaces. Remove PPE before leaving the client's room or space. Dispose of PPE in proper containers, biohazard bags if available. Never reuse disposable gowns or masks. Perform hand hygiene before and after using any PPE. Do not wear PPE in hallways or common areas unless instructed for isolation precautions. Let's take a look at some real-life situations you might face as a home health aide and the proper PPE to use in each case. If a client is coughing and producing mucus, wear a mask and possibly face shield. When assisting with changing an adult brief that has leaked onto bedding, use a gown and gloves. While performing oral care for a client with respiratory infection, you'll need a mask, gloves, and possibly goggles. If you're cleaning up vomit on the floor, wear a gown, mask, gloves, and face shield if splash risk. Always assess the situation and choose PPE that fully protects you from the specific risks involved in each task. Let's look at some common mistakes and why they're dangerous. Wearing a gown but not a mask during coughing care. This allows germs to enter through the nose or mouth, exposing you to respiratory infections. Reusing a mask between clients. This greatly increases the risk of cross-contamination. Wearing PPE for too long or outside the client area. This can spread germs to other areas or people, especially if the PPE is already contaminated. Not wearing eye protection during splash risk tasks. Eyes are highly vulnerable to infection through mucous membranes. Not changing gowns between tasks. Wearing through the transfer germs between surfaces or clients, defeating the purpose of infection control. Avoiding these errors is just as important as knowing when and how to use PPE. Safe care starts with smart, consistent practice. To wrap up this lesson, standard precautions apply to all clients regardless of diagnosis. Use PPE, masks, gowns, gloves, face shields when exposed to body fluids or respiratory droplets. Wear a mask during coughing, oral care, or exposure to respiratory secretions. Use a gown to protect against soiled clothing, linens, or splashes. Follow correct procedures for putting on and removing PPE. Proper PPE use helps prevent infection and protects both caregiver and client in the home setting. When you're ready, let's move on to the next lesson. Bathing the client. Bathing helps maintain cleanliness, comfort, and dignity. In this lesson, you'll learn safe and respectful ways to assist clients with sponge baths, showers, or tub baths while maintaining privacy and preventing injury. Why bathing matters. Bathing is more than just cleaning the body. It's vital for maintaining skin integrity and preventing rashes or infections, boosting circulation through gentle motion and massage, promoting the client's dignity, comfort, and self-esteem, allowing HHAs to observe the skin for bruises, sores, or breakdown. For many clients, bathing may be a time of vulnerability, so your approach, communication, and respect are just as important as technique. Types of baths you may assist with. In home settings, not all clients can take full showers or tub baths. HHAs should be prepared to assist with different types of bathing. Complete bed bath. For clients who are fully bedridden or too weak to assist. Partial bath focuses on face, hands, underarms, and perineal area. Shower. For clients who are mobile with minimal assistance. Tub bath, used less frequently due to slip-fall risk. Therapeutic soak. For clients with specific skin or wound conditions, under RN guidance. Always follow the care plan and the client's current health condition when selecting the type of bath. Preparing for the bath. Before assisting a client with bathing, it's important to be fully prepared, both with supplies and the right approach. Supplies you'll need: a basin for bed or sponge baths, washcloths and towels, mild soap and shampoo, a clean gown or fresh clothing, gloves if there's any risk of body fluid exposure, waterproof pads or towels to protect the bed, and lotion or powder if prescribed in the care plan. Preparation steps. Explain the procedure to the client clearly and kindly. Ensure privacy, close doors, curtains, cover body with towels. Adjust room temperature to keep client warm, around 75-80 degrees Fahrenheit. Position the client safely and comfortably. Make sure supplies are within reach. Wash your hands and wear gloves as needed. Giving a bed bath. Basic step-by-step. Only assist within your training and your agency's guidelines. Bed bath order, cleanest to dirtiest. Eyes and face. Use clean water only, no soap. Neck, ears, and arms. Use a clean section of the cloth for each area. Chest and abdomen. Cover with towel and expose one area at a time. Legs and feet. Wash one at a time and dry thoroughly. Back and buttocks. Support if turning is needed. Perineal area. Last, see agency protocol for proper technique. Here are the key tips. Use gentle strokes. Pat dry rather than rubbing. Keep the client covered as much as possible for warmth and dignity. Support joints if the client is weak or paralyzed. Watch for red areas, open skin, or unusual bruising, and report to the nurse. Shower or tub bath support. If the client can stand or sit safely, ensure non-slip mats or grab bars are in place. Use a shower chair if balance is an issue. Help the client into the bathroom and monitor for fatigue. Allow the client to wash what they can. Assist only where needed. Provide a towel and help them dry and dress afterward. Never leave a weak or dizzy client alone in the bath or shower. After bath care. Bathing doesn't end when the washing is done. After bath care is just as important for your client's comfort, hygiene, and safety. After bathing, apply lotion to dry areas, if prescribed. Help the client dress in clean clothes. Change bed linens if soiled during the bath. Document and report any unusual skin findings, rashes, sores, redness, bruises. Clean all equipment used during the bath. Safely dispose of used water and soiled linens. Respecting privacy and promoting independence. Bathing can be embarrassing or uncomfortable for some clients. As an HHA, you must offer choices: soap, towel, clothing. Let them do what they can themselves. Provide reassurance throughout. Speak kindly and professionally. Use towels to keep the body mostly covered during the bath. Never rush, move at the client's pace. Example: would you like to wash your face? Or would you like me to help? Common mistakes to avoid. Leaving the client exposed causes discomfort and loss of dignity. Using overly hot or cold water may cause injury or discomfort. Washing from dirty to clean spreads germs, ignoring skin changes, misses warning signs of illness. Rushing through the task increases risk of falls and distress. Avoiding these mistakes helps protect your client's health, dignity, and overall experience. Quality care starts with careful attention. Lesson recap. Bathing supports hygiene, comfort, and emotional well-being. Observe the client's skin during the bath for any changes. Prepare the area and respect a client's privacy. Use proper technique, clean to dirty areas, encourage independence, and maintain dignity. Provide aftercare and report any concerns. Bathing is more than a task. It's a chance to support your client's comfort, dignity, and health. With the right technique and compassionate care, you help ensure both safety and trust. Let's continue to the next lesson. In a home care setting, maintaining a clean and safe environment is essential for infection control. This lesson will cover practical ways to reduce the spread of germs in the home, such as proper cleaning techniques, safe disposal of waste, and handling laundry and soiled items correctly. You'll learn how to turn everyday routines into powerful tools for protecting your client's health. Why infection control is different in the home. Unlike hospitals or clinics, home environments are not sterile. Clients may live with pets, family members, or have limited access to supplies. HHAs must bring infection control principles into real-world, everyday settings. Your role is to minimize germ transmission, adapt techniques to the home's layout, keep both the client and their family safe. The goal is a clean, not sterile environment where infection risks are reduced through proper habits. Let's look at common sources of infection in the home care setting. Common ways infection spreads in home care: poor hand hygiene, client or caregiver; improper disposal of body fluids or waste; dirty linens or surfaces; pets, insects, or pests; contaminated medical equipment; thermometers, BP cuffs; visitors bringing in viruses or bacteria. Even clean-looking homes may have infection risks if health habits are overlooked. Cleaning and disinfection basics. Let's start with daily cleaning habits. High-touch surfaces, doorknobs, bed rails, should be wiped with disinfectant daily. Bathroom areas. Be sure to disinfect toilet, faucet handles, and sink. Reusable medical items, such as thermometers, must be clean as directed, e.g., wipe thermometer. If there's a spill of body fluids, wear gloves, clean with disinfectant immediately. Client's table tray, wipe before meals and after use. Always wear gloves when cleaning soiled surfaces or touching contaminated laundry. Let's go over proper disinfectants to use in home care. Start with household bleach. Just be sure it's properly diluted according to the label or guidelines. EPA-registered disinfectant wipes are also effective for killing germs on high-touch surfaces. Soap and hot water may be sufficient. And remember, never mix cleaning products, e.g. bleach plus ammonia. Laundry and linen safety. Dirty laundry, especially if soiled with body fluids, can spread infection. Here are best practices to follow. Wear gloves when handling soiled linens. Roll dirty linens away from your body. Put directly into a plastic laundry bag. Don't shake. Wash with hot water and detergent. Sanitize the laundry area if fluids leaked. Avoid placing linens on furniture or the floor. Let's cover personal belongings and equipment safety. Keep all personal and medical equipment clean and dry, stored separately from family or pet items, disinfected after each use if shared. Examples: thermometers, disinfect after every use; blood pressure cuffs, clean weekly or if visibly dirt; wheelchairs or walkers, wipe down handles and frames. Visitor and pet considerations. Let's start with visitor hygiene. Ask family visitors to wash hands or use sanitizer. Limit visits if someone is sick, cold, flu, etc. Encourage mask use during outbreaks or respiratory illness. Let's talk about pets. Keep pets out of the client's bed or clean care areas. Wash hands after touching animals. Clean up pet waste immediately. Ensure pets are up to date on vaccinations and flea control. Pet fur and saliva can carry germs, especially for clients with weakened immune systems. Food safety. Improper food handling can lead to foodborne illness. Here are some key tips. Wash hands before preparing or serving meals. Clean countertops and utensils thoroughly. Avoid preparing food if you are sick. Refrigerate leftovers immediately. Discard expired or spoiled items. Remember, the kitchen is a high-risk area. Treat it with care just like the bathroom. Trash and waste disposal. Use lined trash bins for easy removal. Dispose of used gloves, tissues, dressings, and adult briefs in sealed plastic bags. If required, use biohazard disposal bags for infectious waste. Take trash out regularly, at least once a day. Educating the client and family. Teach simple infection control reminders, hand washing before meals and after bathroom use, covering coughs and sneezes, cleaning shared surfaces, watching for signs of infection, fever, redness, swelling, discharge. Use calm, clear explanations. Help the client and their loved ones feel involved and informed, not overwhelmed. Let's review the key points from this lesson on infection prevention in the home. Home environments aren't sterile. Stay alert to infection risks like dirty linens, pets, and shared equipment. Practice proper cleaning, waste disposal, linen handling, and surface disinfection. Involve family members and visitors in safe practices. Ensure food, laundry, and medical tools are handled with care. Good habits, clear communication, and consistent infection control are key to safe home care. When you're ready, continue to the next lesson. Proper cleaning and disinfection are key to stopping the spread of harmful germs in a home care setting. In this lesson, you'll learn the difference between cleaning and disinfecting, how to safely sanitize surfaces and equipment, and how to dispose of waste, especially contaminated items, correctly. These skills help ensure a safe, healthy environment for both you and your client. Why cleaning, disinfection, and disposal matter in home care. In a home care setting, the environment is not controlled like a hospital, and yet the risk of infection is still real. That's why HHAs must follow strict cleaning and disinfection protocols to reduce the spread of harmful microorganisms. Cleaning removes visible dirt, food, or body fluids. Disinfection kills most harmful germs that remain after cleaning. Proper disposal prevents spread through contaminated items or waste. These are essential parts of protecting both the client and the caregiver. To protect clients in a home care setting, it's important to understand the difference between cleaning and disinfection, and why both are necessary. Cleaning means physically removes dirt and germs from surfaces. Examples include sweeping and wiping with soap and water. Disinfection, on the other hand, means using chemicals to kill germs left behind after cleaning. Common disinfectants include bleach solutions and alcohol wipes. Important: cleaning must happen first before disinfection is effective. Daily and routine cleaning tasks. As an HHA, you are responsible for keeping the client's personal care area, equipment, and surfaces clean. Areas that need daily cleaning: bed rails and nightstands, over bed tables or tray tables, bathroom handles, toilet seat, and sink, kitchen counters, especially if meds or food are prepared there, wheelchair handles, walkers, or assistive devices. Use soap and warm water for basic cleaning. Then disinfect high-touch or body fluid-exposed surfaces. Proper disinfection procedures. Safe disinfectants. 1. 10 bleach solution, 1 part bleach plus 9 parts water. EPA-approved disinfectant sprays or wipes. 70% alcohol-based solutions for thermometers or small tools. Disinfection steps. Clean the surface first. Remove dirt, debris. Apply disinfectant. Make sure the surface stays wet for the time listed on the label. Air dry or wipe with a clean cloth if needed. Wash your hands or remove gloves when done. Always disinfect surfaces touched after contact with blood, urine, vomit, feces, or any body fluids. Cleaning contaminated equipment. Contaminated equipment can easily spread germs if not cleaned properly. Here's how to disinfect common tools used in home care. Thermometers. Wipe with alcohol swab after each use. Blood pressure cuffs. Wipe with disinfectant wipe after each client. Bedpans and urinals. Rinse, wash with soap, and disinfect after each use. Wheelchairs. Clean handles, armrests, and footrests daily. If you don't know whether an item can be washed or sprayed, ask the supervising nurse or check manufacturer instructions. Proper disposal of waste. Waste from home care may carry germs and must be disposed of safely. Regular waste use tissues, gloves, not soaked in blood, small dressings, disposed in lined household trash bins. Remove trash at least once a day. Contaminated waste, large dressings soaked in blood or fluids, adult diapers, briefs with visible waste, items used on infected wounds. Use double bags if leakage is possible and dispose of in a sealed trash container. If required by agency state, use biohazard bags. Linen handling and disposal. Soiled linens, bedsheets, towels, clothing, may spread infection if handled improperly. Linen safety: wear gloves. Roll linens away from your body. Don't shake. Place directly in a plastic laundry bag or designated bin. Wash with hot water and detergent. Disinfect laundry area if spills occurred. Never place used linens on furniture, beds, or clean surfaces. Sharps and medical waste, if applicable. Home clients may use needles for insulin or other injections. HHAs should not handle needles directly unless trained and allowed by their agency. If sharps are present, they should be discarded in a hard-sided, puncture-proof sharps container. Do not throw needles in regular trash. If full, inform the nurse or family caregiver to arrange for disposal. Final safety reminders. Here are a few final safety reminders to keep in mind during cleaning and disposal tasks. Always wear gloves when cleaning bodily fluids or contaminated items. Never mix cleaning products. Bleach plus ammonia equals toxic gas. Clean from clean to dirty areas to avoid spreading germs. Perform hand hygiene before and after all cleaning or disposal tasks. If exposed to body fluids, report immediately and follow agency protocol. To reduce the risk of infection, remember these key practices. Clean high-touch areas daily to reduce infection risk. Disinfect surfaces exposed to body fluids. Safely dispose of soiled items like dressings and gloves. Handle reusable tools and linens properly to prevent cross-contamination. These practices protect clients, caregivers, and others in the home. When you're ready, continue to the next lesson. Bathing the client. Bathing helps maintain cleanliness, comfort, and dignity. In this lesson, you'll learn safe and respectful ways to assist clients with sponge baths, showers, or tub baths while maintaining privacy and preventing injury. Why bathing matters. Bathing is more than just cleaning the body. It's vital for maintaining skin integrity and preventing rashes or infections, boosting circulation through gentle motion and massage, promoting the client's dignity, comfort, and self-esteem, allowing HHAs to observe the skin for bruises, sores, or breakdown. For many clients, bathing may be a time of vulnerability, so your approach, communication, and respect are just as important as technique. Types of baths you may assist with. In home settings, not all clients can take full showers or tub baths. HHAs should be prepared to assist with different types of bathing. Complete bed bath, for clients who are fully bedridden or too weak to assist. Partial bath focuses on face, hands, underarms, and perineal area. Shower, for clients who are mobile with minimal assistance. Tub bath, used less frequently due to slip-fall risk. Therapeutic soak, for clients with specific skin or wound conditions, under RN guidance. Always follow the care plan and the client's current health condition when selecting the type of bath. Preparing for the bath. Before assisting a client with bathing, it's important to be fully prepared, both with supplies and the right approach. Supplies you'll need: a basin for bed or sponge baths, washcloths and towels, mild soap and shampoo, a clean gown or fresh clothing, gloves if there's any risk of body fluid exposure, waterproof pads or towels to protect the bed, and lotion or powder if prescribed in the care plan. Preparation steps. Explain the procedure to the client clearly and kindly. Ensure privacy, close doors, curtains, cover body with towels. Adjust room temperature to keep client warm, around 75–80 degrees Fahrenheit. Position the client safely and comfortably. Make sure supplies are within reach. Wash your hands and wear gloves as needed. Giving a bed bath. Basic step-by-step. Only assist within your training and your agency's guidelines. Bed bath order, cleanest to dirtiest. Eyes and face. Use clean water only, no soap. Neck, ears, and arms. Use a clean section of the cloth for each area. Chest and abdomen. Cover with towel and expose one area at a time. Legs and feet. Wash one at a time and dry thoroughly. Back and buttocks. Support if turning is needed. Perineal area. Last, see agency protocol for proper technique. Here are the key tips. Use gentle strokes. Pat dry rather than rubbing. Keep the client covered as much as possible for warmth and dignity. Support joints if the client is weak or paralyzed. Watch for red areas, open skin, or unusual bruising, and report to the nurse. Shower or tub bath support. If the client can stand or sit safely, ensure non-slip mats or grab bars are in place. Use a shower chair if balance is an issue. Help the client into the bathroom and monitor for fatigue. Allow the client to wash what they can. Assist only where needed. Provide a towel and help them dry and dress afterward. Never leave a weak or dizzy client alone in the bath or shower. After bath care. Bathing doesn't end when the washing is done. After bath care is just as important for your client's comfort, hygiene, and safety. After bathing, apply lotion to dry areas, if prescribed. Help the client dress in clean clothes. Change bed linens if soiled during the bath. Document and report any unusual skin findings, rashes, sores, redness, bruises. Clean all equipment used during the bath. Safely dispose of used water and soiled linens. Respecting privacy and promoting independence. Bathing can be embarrassing or uncomfortable for some clients. As an HHA, you must offer choices: soap, towel, clothing. Let them do what they can themselves. Provide reassurance throughout. Speak kindly and professionally. Use towels to keep the body mostly covered during the bath. Never rush, move at the client's pace. Example: would you like to wash your face? Or would you like me to help? Common mistakes to avoid. Leaving the client exposed causes discomfort and loss of dignity. Using overly hot or cold water may cause injury or discomfort. Washing from dirty to clean spreads germs, ignoring skin changes, misses warning signs of illness. Rushing through the task increases risk of falls and distress. Avoiding these mistakes helps protect your client's health, dignity, and overall experience. Quality care starts with careful attention. Lesson recap: bathing supports hygiene, comfort, and emotional well-being. Observe the client's skin during the bath for any changes. Prepare the area and respect a client's privacy. Use proper technique, clean to dirty areas, encourage independence, and maintain dignity. Provide aftercare and report any concerns. Bathing is more than a task. It's a chance to support your client's comfort, dignity, and health. With the right technique and compassionate care, you help ensure both safety and trust. Let's continue to the next lesson. Helping clients dress and groom themselves supports their independence and self-esteem. This lesson covers how to assist with clothing choices, dressing, brushing hair, and basic grooming routines. The importance of dressing and grooming. Dressing and grooming are essential daily routines that promote dignity and self-worth, encourage independence and emotional well-being, help maintain personal hygiene and skin health, give the HHA a chance to observe changes in behavior or physical condition. Even small tasks like combing hair or choosing clothes can significantly impact a client's confidence and mood. Respecting preferences and encouraging independence. Always involve the client as much as possible. Ask them what they'd like to wear. Allow them to do what they can, e.g., buttoning, brushing hair. Respect their style, religion, and cultural clothing preferences. Offer choices and explain each step before beginning. Example: would you like the blue shirt or the striped one today? Dressing assistance guidelines. When helping a client dress or undress, follow these principles. General tips: ensure privacy, close doors and cover with a towel or blanket. Choose comfortable, easy-to-wear clothes, especially if the client has limited mobility. Dress the weaker or affected side first, then the stronger side. Undress the stronger side first, then the weaker side. Encourage the client to participate as much as possible. Allow enough time, never rush or force movements. Check for tags, seams, or tight areas that might cause discomfort or pressure sores. Dressing a client with limited mobility. Use adaptive clothing if available. Velcro closures, elastic waists. Position the client safely, either sitting in a chair or lying on the bed. Support the limbs gently during movement. Use non-skid socks or shoes after dressing to prevent falls. If dressing in bed, keep one side of the body covered while assisting with the other. Grooming tasks you may assist with. As a home health aide, grooming assistance may include hair care, brush or comb gently, assist with styling if requested, shaving, use electric razor, never a straight razor unless agency allows. Ask about preferences. Oral hygiene, if not covered in other modules, assist with brushing or rinsing, especially in the morning. Nail care, only file nails, do not cut unless certified and allowed by state/agency. Skin lotion or deodorant, apply as requested or per care plan. Avoid scented products if skin is sensitive. Eyeglasses, hearing aids, dentures. Help clean and place them if the client cannot do so alone. Always remember, never perform grooming tasks like nail trimming, foot care, or shaving with a blade unless specifically trained and authorized. Dressing for weather and safety. Help the client choose clothing that is weather appropriate, for example, warm layers in winter, breathable fabrics in summer, easy to remove for toileting needs, safe, avoid long dragging pants or slippery socks, comfortable, loose enough to allow circulation, but not so loose that they trip. Clients should not sleep in daytime clothing unless the care plan says otherwise. Cultural, religious, and personal considerations. When assisting with grooming, it's important to respect each client's cultural, religious, and personal values. Be respectful of cultural or religious attire, head coverings, modesty rules. Gender-related preferences. Some clients prefer same-gender caregivers for grooming. Hair and skincare routines that are specific to the client's background. Makeup or accessories that make the client feel more like themselves. Tip: ask the client or family what is important in their grooming habits. Common errors to avoid. Here are some common errors to watch out for. Dressing the stronger side first causes unnecessary strain and discomfort. Ignoring the client's clothing choices undermines autonomy and dignity. Rushing the task increases risk of injury and anxiety. Using scented products without asking can irritate sensitive skin or allergies. Leaving clothing wrinkled or twisted can cause discomfort or pressure injuries. By avoiding these mistakes, you provide safer, more respectful care that supports your client's comfort and well-being. Observing and reporting. As a home health aide, your role goes beyond helping with grooming. You're also the eyes and ears for the care team. While assisting, be alert for skin redness, bruising or rashes. Unusual resistance to grooming could indicate depression or discomfort. Weight gain loss, clothes fitting differently, changes in hair or skin condition, sores near elastic bands or pressure points. Report all unusual findings to your supervising nurse promptly. This lesson covered the key principles of assisting with dressing and grooming in a home care setting. Support client independence, preferences, and dignity. Dress the weaker side first for safety and ease. Assist with grooming tasks like brushing hair, shaving, or applying lotion. Promote hygiene, comfort, and emotional well-being. Be aware of cultural and personal factors. Report any physical or behavioral changes. Provide respectful, patient assistance to empower the client. Respectful, personalized care empowers your client and supports their dignity every day. Let's continue to the next lesson. Oral care is crucial for preventing infections and promoting comfort. You'll learn how to safely clean natural teeth and dentures and how to help clients who are unable to perform oral care themselves. Why oral hygiene matters in home care. In this section, oral hygiene is not just about having a clean mouth, it's essential for the clients. Overall health. Poor oral hygiene can lead to infections, gum disease, or heart problems. Nutrition, pain or discomfort may cause clients to eat less. Comfort and self-esteem. A clean mouth improves breath, confidence, and comfort. Disease prevention reduces the risk of pneumonia and systemic infections, especially in elderly clients. Regular oral care can also help you identify signs of other health issues early. Your role as an HHA in oral hygiene. Home health aides help clients with oral hygiene by assisting with brushing, rinsing, and flossing, cleaning and caring for dentures, observing for any mouth sores, bleeding gums, foul odor, or loose teeth, reporting oral problems to the nurse, encouraging independence if the client is able to brush on their own. Never force the client's mouth open or clean beyond your training. Equipment and supplies. Before assisting with oral hygiene, it's important to gather the right supplies. What you need depends on whether the client has natural teeth or dentures. For natural teeth, soft bristled toothbrush, fluoride toothpaste, cup of water, towel or paper towels, emesis basin, if client cannot rinse in sink, gloves. And for dentures, denture brush or soft toothbrush, denture cleanser, never regular toothpaste, denture container or labeled cup, lukewarm water, never hot, clean towel or washcloth to prevent breaking if dropped. Oral care for clients with natural teeth. Steps for assisting with toothbrushing. Wash your hands and wear gloves. Sit the client upright in a chair or bed. Drape a towel across the client's chest. Moisten the toothbrush and apply a pea-sized amount of toothpaste. Gently brush all tooth surfaces, outer, inner, and chewing surfaces. Brush the tongue lightly to remove bacteria. Offer water to rinse and allow the client to spit into a basin. Dry their mouth and face and remove gloves properly. Wash hands and report any issues. Bleeding gums, pain, broken teeth. Brush at least twice a day, especially after breakfast and before bed. Oral care for unconscious or dependent clients. If a client is unconscious or unable to cooperate, special care must be taken. Key differences. Use a foam swab instead of a toothbrush. Position client on their side to prevent choking. Use minimal water and swab gently. Suction may be used, by a nurse, for excess fluid. Monitor for gagging, choking, or resistance. Never pour water into the mouth of an unconscious person. Denture care. Clients with full or partial dentures require daily cleaning and proper storage. Cleaning dentures. Wash hands and put on gloves. Place a towel in the sink or fill it with water to protect dentures if dropped. Remove dentures carefully, upper first, then lower. Use a denture brush and denture cleanser, not regular toothpaste. Rinse thoroughly under cool or lukewarm water. Soak in denture solution or water overnight if client removes them at night. Brush the client's gums and tongue with a soft brush or swab. Assist the client in reinserting dentures, ensuring proper fit and comfort. Remember, never use hot water. It can warp dentures. And never leave dentures in a dry cup. Signs of oral health problems. Observe and report any of the following: red, swollen, or bleeding gums, cracked lips or mouth sores, bad breath that doesn't go away, loose or missing teeth, complaints of mouth pain or trouble eating, ill-fitting dentures, slipping, discomfort, or sores. Document and report any issues to the supervising nurse. Encouraging participation and dignity. When assisting with oral care, always focus on the client's comfort, independence, and dignity. Always explain what you're doing and ask permission. Let the client choose their toothpaste or routine if possible. Allow clients to brush or rinse as independently as they can. Be gentle and patient, especially with elderly or sensitive clients. Keep supplies clean and personal. Do not share between clients. Would you like to try brushing first, or would you like my help today? This respectful approach helps the client feel more in control and valued. Common mistakes to avoid. Even well-meaning caregivers can make mistakes during oral care. Let's review some common errors and why they matter. Using hot water for dentures can warp or damage them. Rushing the procedure may cause discomfort or miss areas. Using regular toothpaste on dentures. Abrasive and damaging. Not brushing the tongue or gums leaves bacteria in the mouth. Ignoring signs of mouth pain could delay treatment of serious issues. Avoiding these mistakes ensures your client's safety, comfort, and long-term oral health. This lesson covered the key responsibilities of providing safe and effective oral care for clients in a home care setting. Support both denture and natural tooth care. Promote health, comfort, and early illness detection. Use safe, respectful techniques, even with unconscious clients. Encourage independence when possible. Observe carefully to protect well-being. By supporting both denture and natural tooth care with safe, respectful techniques, you help protect your client's health, comfort, and dignity, one small step at a time. Let's continue to the next lesson. Proper perineal care prevents infections and promotes comfort and dignity. This lesson teaches how to assist with toileting, use of bedpans or commodes, and how to clean sensitive areas properly and respectfully. Why perineal care and toileting matter. Perineal care is the cleaning of the genital and anal areas. It's vital for preventing infections, especially urinary tract infections, UTIs, maintaining skin integrity in sensitive areas, ensuring dignity and comfort for the client, promoting good hygiene and reducing odors, observing for health issues like skin breakdown, redness, or discharge. Toileting assistance, meanwhile, helps clients remain continent, clean, and confident in their daily routines. HHA's role in perineal care and toileting. You may be required to assist with toileting, bedpan, commode, bathroom, provide perineal care after urination, bowel movements, or incontinence episodes, help clients use incontinence pads, briefs, or catheters, clean and reposition the client after toileting, report any skin changes, discomfort, or unusual discharges. Always follow the client's care plan and your agency's policy. Toileting options and assistance. In home care, toileting needs vary from client to client. As a caregiver, it's important to understand the different aids available and when to use them. Common toileting aids: bedpan, regular or fracture, for bedridden clients; commode chair, for clients who can sit but not walk far; toilet, for clients who can transfer independently or with help; Incontinence products for clients with bladder, bowel control issues. Assistance guidelines. Provide privacy, close doors, cover with blankets. Allow time and do not rush. Position bed or commode for safety and comfort. Use proper body mechanics when lifting or assisting. Use non-skid footwear if walking to the bathroom. Help clean afterward if needed, using tissue, wipes, or washcloths. When and how to perform perineal care. Perineal care should be provided after each episode of incontinence, after a bowel movement or urination, especially in females, during a full or partial bed bath, if the client uses a catheter, anytime there is soiling, odor, or risk of irritation. Supplies for perineal care. Gloves. Warm water and mild soap or pre-moistened wipes. Soft washcloths or disposable wipes. Waterproof pad to protect bedding. Towel for drying. Clean briefs, incontinence pads, or linen if needed. Take note: do not use harsh soaps or heavily scented products. Performing perineal care. Step by step. Female clients. Wash hands and wear gloves. Place waterproof pad under client's hips. Expose only the area being cleaned. Maintain dignity. Clean front to back, from urethra to anus, using a fresh part of the cloth with each wipe. Rinse and gently pat dry. Remove gloves, wash hands, and redress client. Male clients, wash hands and wear gloves. If uncircumcised, gently pull back foreskin, if care plan allows. Clean tip of penis first, using circular motion outward. Clean shaft, then scrotum. Rinse and pat dry. If foreskin was retracted, gently return it to place. Remove gloves, wash hands, and redress client. For all genders, anal area, always clean front to back. Use a fresh wipe or cloth section for each stroke. Pat dry thoroughly to prevent moisture sores. Observe for hemorrhoids, skin breakdown, or wounds. Catheter care, if applicable. HHAs do not insert or remove catheters, but they may assist with hygiene around one. Clean around the catheter insertion site using soap and water. Wipe away from the body, down the tubing, never toward the insertion site. Keep tubing free of kinks and bag below bladder level. Report any signs of infection: odor, redness, swelling, cloudy urine. Incontinence products. Clients who use briefs or pads must be kept clean and dry to prevent skin breakdown, infections, emotional distress, or embarrassment. Brief changing tips. Change as soon as soiled. Use gentle cleansing techniques. Roll client carefully. Wipe both front and back. Reposition and ensure brief fits snugly but comfortably. Dispose of soiled items in a sealed bag or lined trash bin. Observation and reporting. As a caregiver, your role includes more than just providing support. You're also the eyes and ears for changes in your client's condition, especially during toileting and personal care. Watch for redness, swelling, rashes, or irritation. Odors that suggest infection. Discomfort or pain during toileting. Unusual discharge or stool urine color. Changes in urinary, bowel habits. Constipation, diarrhea, leakage. Remember, report findings to your supervisor or nurse as per your agency protocol. Promoting privacy, comfort, and dignity. Toileting can be a sensitive and sometimes embarrassing task for clients. As a HHA, your approach can make all the difference. Always knock before entering. Use towels or blankets to cover the client when possible. Use respectful, neutral language. Offer choices or example. Would you like to try the bathroom now? Be calm and reassuring, especially if the client is embarrassed. A simple phrase like, "Let me help you get comfortable again. You're doing great," can go a long way in building trust and maintaining dignity. Common mistakes to avoid. Cleaning back to front spreads bacteria and increases UTI risk. Using the same cloth for multiple areas can spread infection. Failing to dry the area thoroughly increases risk of skin breakdown. Not changing soiled briefs promptly. causes discomfort and odor. Ignoring signs of discomfort or rash misses early symptoms of infection. Remember, good technique means more than just being thorough. It's about being thoughtful and observant. This lesson focused on providing safe, respectful toileting and perineal care. Assist clients with toileting and perineal care respectfully and hygienically. Protect skin, dignity, and comfort during sensitive tasks. Follow step-by-step instructions for male, female, and catheter care. Maintain cleanliness and ensure client privacy. Watch for signs of infection or discomfort. HHAs help prevent complications and support client well-being. By following proper steps and observing closely, HHAs protect the client's health, dignity, and comfort. Skin breakdown can lead to serious health issues. In this lesson, you'll learn how to perform routine skin checks, promote circulation, and help prevent pressure injuries through repositioning and skin care. Maintaining healthy skin and preventing pressure injuries, also called pressure sores or bed sores, are critical responsibilities of a home health aide, HHA. The skin is the body's largest organ and serves as a protective barrier. When the skin breaks down, especially in older adults or those who are immobile, it can lead to serious infections and discomfort. This lesson focuses exclusively on how HHAs can observe, protect, and care for a client's skin and take steps to prevent pressure injuries through routine care, observation, and proper positioning techniques. Understanding skin integrity. What is skin integrity? Skin integrity refers to skin that is whole, undamaged, and functioning normally. Healthy skin protects against germs and fluid loss, helps regulate body temperature, acts as a sensory organ for pain, temperature, and touch. When the skin becomes fragile, dry, or broken, it is at increased risk for pressure injuries, infection, and pain. Factors that affect skin health: age, thinner skin in elderly clients, immobility, incontinence, urine or feces can irritate the skin, poor nutrition and hydration, medical conditions, e.g. diabetes, poor circulation, medications such as steroids or blood thinners. Pressure injuries. What are they? What is a pressure injury? A pressure injury is localized damage to the skin and/or underlying tissue, usually over a bony area, caused by pressure from lying or sitting in the same position for too long, shearing, skin moving in one direction while bone moves in another, friction, rubbing against surfaces like sheets or clothing. Common sites: heels, hips, elbows, tailbone, sacrum, shoulders, back of the head. Observing for skin changes. As a home health aide, you are often the first to notice changes in the client's skin. Early identification is key to preventing more serious problems. What to look for: redness that doesn't fade after pressure is relieved, swelling or warmth over a bony area, blisters or open sores, bruising or purple discoloration, dry, flaky, or cracked skin. Always report new skin breakdowns, changes in skin color or texture, complaints of pain in one area when touched. Skincare techniques. Daily skincare routine. Gentle cleansing using mild soap and warm water. Thorough drying, especially in folds, under breasts, groin, between toes. Moisturizing dry skin with lotion, unless contraindicated. Change clothing and linens regularly to keep skin dry and clean. Use absorbent pads or briefs if the client is incontinent. Things to avoid: harsh scrubbing, hot water, powders or alcohol-based products. They dry out the skin. Using the same washcloth for different parts of the body. Preventing pressure injuries. Repositioning clients. Every 2 hours for clients in bed. Every 15-30 minutes for clients in wheelchairs. Encourage small shifts or assist if needed. Positioning techniques. Use pillows or foam wedges to support the body. Keep heels off the bed with a cushion or heel protector. Maintain good alignment of head, shoulders, hips, and legs. Reduce friction and shearing. Lift, don't drag, the client during transfers or repositioning. Use draw sheets when turning a client in bed. Raise the head of the bed only as needed to avoid sliding. Supporting skin health with nutrition and fluids. Proper nutrition and hydration are essential for skin repair and strength. Encourage protein-rich foods, eggs, meat, beans. Foods high in vitamin C and zinc, important for healing. Adequate fluid intake, unless restricted. As an HHA, while you do not prescribe diets, you can monitor if a client is eating and drinking enough and report poor intake to the nurse. Skincare is vital. HHAs play a key role in protecting the body's first line of defense. Skincare and pressure injury prevention are essential in home healthcare. HHAs are in a key position to observe, report, and assist in maintaining skin health. Regular care activities like cleaning and repositioning help prevent serious conditions. Compassionate care protects the client's skin, the body's vital barrier. With regular care and compassion, you help prevent pressure injuries and support overall health. Maintaining proper nutrition and hydration is essential for every client's health, healing, energy, and overall well-being. Many clients receiving home healthcare require assistance with meals, whether due to physical limitations, cognitive impairments, or medical conditions. As a home health aide HHA, your role includes assisting clients with eating and drinking, observing for dietary needs or issues, and promoting a safe and pleasant mealtime experience. This lesson focuses solely on how to provide support with eating, hydration, and basic nutrition, helping clients maintain dignity and health during one of the most important daily activities. The HHA's role in mealtime assistance. Key responsibilities: setting up meals within reach, opening containers or cutting food as needed, assisting with utensils if the client has difficulty, feeding the client when necessary, encouraging proper positioning and pace during meals, observing and reporting food and fluid intake. Individualized assistance. Some clients may only need light support, for example, removing lids. Others may need full feeding assistance due to weakness, tremors, or dementia. Always follow the care plan or nurse instructions on the level of help required. Preparing the client and environment. Before mealtime, wash your hands and help the client wash theirs. Ensure the client is sitting upright, preferably in a chair or at least 75-90 degrees in bed. Protect clothing with a towel or clothing protector if the client agrees. Confirm you have the correct diet tray and follow any special diet orders. Meal setup. Place the tray table in a comfortable, easy-to-reach position. Check the temperature of hot foods and beverages. Offer a straw, adaptive utensils, or grip-enhanced cups if needed. Feeding techniques and considerations. Feeding basics. Offer food in small portions. Alternate between food and fluids. Never rush. Give the client time to chew and swallow. Observe for coughing, choking, or difficulty swallowing. May indicate a swallowing problem or dysphagia. In respect and encouragement. Engage in friendly conversation during meals. Avoid talking about unpleasant topics, illness, medical issues. If feeding, sit at eye level, maintain eye contact, and explain each step. Here's a bite of potatoes. In what to avoid: feeding clients while they are lying flat, mixing all food together unless requested, forcing food or arguing about what they don't want to eat. Hydration, encouraging fluid intake. Why fluids matter. Proper hydration helps with digestion, circulation, temperature regulation, preventing urinary tract infections and constipation, promoting fluid intake. Offer water and fluids frequently throughout the day, especially with meals and snacks. Use measuring cups or logs to track fluid intake if instructed. Watch for signs of dehydration, dry mouth, dark urine, dizziness, confusion. If any signs are observed, report immediately to the nurse or supervisor. Understanding special diets and restrictions. Common special diets: low sodium, for heart conditions or high blood pressure. Diabetic, carbohydrate controlled, for blood sugar management. Mechanical soft or pureed, for clients with chewing, swallowing problems. Thickened liquids, for dysphagia. Follow thickness instructions exactly. Following the care plan. Never give restricted foods. Only serve what is listed in the care plan. If the client requests other food, politely explain the restriction and inform the nurse. Monitoring and reporting intake. Accurate observation and reporting help the healthcare team track the client's nutritional status. What to monitor: how much of each meal was eaten, any difficulty chewing, swallowing, or using utensils, refusal to eat, signs of nausea, pain, or choking, fluid intake amounts if required, use provided forms or verbal reports to update the supervising nurse. This lesson highlighted the HHA's role in supporting safe, respectful mealtime care. HHAs support health, dignity, and comfort through every meal. Assistance with eating and hydration helps prevent dehydration, malnutrition, and weight loss. Observing and promoting proper nutrition makes a daily impact. Safe, respectful, person-centered mealtime care is vital in home health. Every meal is a chance to promote health, dignity, and well-being. Personal hygiene is a key part of preserving health and dignity for clients receiving home care. While bathing and oral care are commonly emphasized, hair, nail, and foot care also play essential roles in client comfort, cleanliness, and overall well-being. In this lesson, we'll explore how HHAs can safely and respectfully assist non-diabetic clients with grooming and hygiene tasks that boost self-esteem, reduce the risk of infections, and promote independence. This lesson focuses only on hair, nail, and foot care for non-diabetic individuals, as diabetic foot and nail care requires special medical supervision and will not be covered here. Hair care. Importance of hair care: promotes cleanliness and hygiene, helps prevent itching, matting, and scalp issues, boosts self-confidence and a sense of dignity, encourages daily interaction and emotional well-being. Hair care duties may include brushing and combing hair gently to prevent tangles, washing hair during bath or separately at the sink, bedside, assisting with hairstyling, drying, or braiding, supporting the use of wigs, hair coverings, or styling preferences. Tips for safe hair care: use a soft bristled brush or wide-tooth comb. Detangle starting from the ends and working upward. Avoid pulling or yanking hair. Use warm, not hot water and gentle shampoo. Protect pillows and clothing with towels during washing. Ask the client how they prefer their hair styled. Note: do not cut or dye a client's hair unless specifically trained, allowed by agency policy, and given written permission. Nail care, fingernails only. Why nail care matters: prevents buildup of dirt and bacteria, reduces the risk of scratches and skin infections, increases comfort and mobility, helps maintain personal appearance. Basic fingernail care tasks: soaking hands in warm water to soften nails, cleaning under nails with a soft nail file or orange stick, trimming nails straight across, filing sharp edges to prevent snags or scratches. Safety guidelines: do not cut nails if the client is diabetic or has circulation issues. Report to nurse instead. Use only clean tools and wash hands before and after care. Never cut nails too short or dig into nail corners. Risk of ingrown nails. Avoid using scissors. Use clippers and an emery board. Discontinue and report if you see signs of infection, redness, swelling, pus. Foot care, non-diabetic clients only. Purpose of foot care: prevents odor, fungal infections, and skin breakdown. Maintains comfort while walking or wearing shoes. Enhances circulation through gentle handling. Allows for early identification of any foot problems. Routine foot care tasks: soaking feet in warm water for 10 to 15 minutes, gently washing between toes and drying thoroughly. Applying moisturizer to heels and soles, but not between the toes. Filing rough areas or thick nails carefully if permitted. Helping the client put on socks and shoes or slippers afterward. Important precautions: avoid trimming toenails unless trained and instructed to do so. Never cut calluses, corns, or thicken nails. Report to nurse or podiatrist. Use non-slip mats and towels to prevent falls during foot care. Watch for signs of infection, irritation, or sores, especially in clients with poor circulation. Observation and reporting. As a home health aide, your observations are essential to the care team. While providing hair, nail, and foot care, always take note of redness, rashes, swelling, or open sores, nail discoloration or thickening, odors, fungal growth, or dry, cracked skin, any complaints of pain or burning. Immediately report anything unusual to your supervising nurse or care coordinator. Infection control and cleanliness. Hygiene reminders. Always wash your hands before and after grooming tasks. Wear gloves if there are open wounds or broken skin. Disinfect reusable equipment, e.g., nail files, or use disposable ones. Never share grooming supplies between clients. This lesson focused on how gentle, respectful hair, nail, and foot care supports comfort and confidence. Hair, nail, and foot care support self-worth and comfort. HHAs should provide care with gentleness, patience, and safety. Respecting preferences and observing for issues builds trust. Proper hygiene care promotes well-being and independence for non-diabetic clients. By providing safe, attentive hygiene care, you help promote dignity and independence. Let's move on to the next lesson. Transferring clients safely. Bed to chair, walker. Safe client transfers are one of the most vital tasks a home health aide, HHA, performs daily. Whether moving a client from a bed to a chair or helping them stand using a walker, proper transfer techniques protect both the client and the caregiver from injury. In this lesson, we'll break down how to safely perform these movements step by step, emphasizing the importance of body mechanics, clear communication, safety equipment, and client dignity. Understanding transfers. What is a transfer? A transfer is moving a client from one position or surface to another, commonly from bed to chair to bed to walker or wheelchair. Why safe transfers matter. Prevent falls and injuries. Reduce strain on caregivers' back and joints. Preserve the client's dignity and independence. Encourage mobility and circulation. Preparing for a safe transfer. Gather supplies. Gait belt if required. Wheelchair or chair with brakes. Non-slip footwear for the client. Walker if needed. Gloves if appropriate. Communication tools for nonverbal clients. Safety checklist before transfer. Explain the procedure clearly to the client. Lock the wheelchair or bed brakes. Adjust the bed height to match the transfer surface. Ensure the area is clear of obstacles. Check that the client is wearing secure footwear. Use a gait belt if instructed in the care plan. Transfer from bed to chair. Step-by-step instructions. Position the chair. Place the wheelchair or chair at a 45-degree angle to the bed, on the client's stronger side if applicable. Lock the brakes. Prepare the client. Assist the client into a sitting position on the edge of the bed. Let them dangle their legs for a moment to prevent dizziness. Apply gait belt if used. Place around client's waist, snug but comfortable. Position yourself. Stand in front of the client, knees slightly bent, feet shoulder-width apart. Give instructions. On the count of 3, push off the bed and stand. Transfer the client. Hold the gait belt firmly with both hands or provide support under the arms, if not using a belt. Help the client stand, pivot toward the chair, and slowly lower into the seat. Tips: never pull on the client's arms or underarms. Always count and move together. Let the client do as much as they can independently. Transfer from bed to walker. Step-by-step instructions. Position the walker. Place the walker directly in front of the client within easy reach. Prepare the client. Sit client on the edge of the bed. Let them rest for a moment to avoid dizziness. Apply gait belt if required. Assist to stand. Support the client as they stand and place both hands on the walker. Encourage the client to stand straight and check for balance. Assess readiness to walk. Instruct them to take small steps using the walker while you walk slightly behind and to the side. Tips: do not allow the client to pull on the walker to stand up. Ensure all walker legs are on the ground before movement. Stay alert to signs of fatigue or imbalance. Using proper body mechanics. For the HHA, keep your back straight and use your leg muscles to lift. Bend at the knees, not the waist. Keep the client close to your body. Avoid twisting, pivot with your feet. Ask for help if the client is too heavy or unstable. Observing and reporting. While transferring, always observe and report. Difficulty with balance or weakness. Signs of dizziness, shortness of breath, or fatigue. skin redness or irritation where the gait belt was applied, fear or reluctance to move. Report to the nurse or supervisor immediately if the client falls, experiences pain, or refuses to transfer. This lesson covered safe, respectful techniques for assisting with client transfers. Client transfers require knowledge, technique, and empathy. Aim for safe, smooth, and respectful movement. Use proper body mechanics and follow safety protocols. Encourage independence to boost client confidence. Protects both client and caregiver, key to skilled HHA work. With proper skills and empathy, transfers become safe, smooth, and empowering for both client and caregiver. Ambulation assistance and fall prevention. Helping clients move safely and confidently is one of the most vital responsibilities of a home health aide, HHA. Whether walking with assistance or independently, ambulation improves a client's circulation, digestion, mental well-being, and independence. However, falls remain a major safety concern in home care. This lesson will teach you how to assist with ambulation using proper support techniques, recognize fall risks, and implement preventative strategies, all while promoting dignity and confidence in every step. Understanding ambulation. What is ambulation? Ambulation simply means helping a client walk safely from one place to another, whether with or without assistive devices. Benefits of ambulation. Improves circulation and respiratory health. Prevents muscle weakness and joint stiffness. Reduces constipation and risk of pressure injuries. Enhances emotional and mental well-being. Preparing for safe ambulation. Pre-ambulation checklist. Check the care plan to confirm the level of assistance required. Communicate clearly with the client before moving. Ensure the client is wearing non-skid footwear. Make sure any assistive devices, cane, walker, are within reach and in good condition. Verify that environmental hazards, loose rugs, cords, clutter, are removed. Confirm the client is not dizzy, drowsy, or in pain before standing. Assisting with ambulation. General guidelines. Stand on the client's weaker side, slightly behind. If using a gait belt, hold it securely at the back or side. Encourage the client to take slow, steady steps. Never rush or pull the client. Be alert for signs of fatigue, dizziness, or imbalance. Helping a client use. A cane, held on the stronger side. The cane and the weaker leg move together, followed by the stronger leg. A walker. Instruct the client to move the walker a short distance ahead, then step forward with the weaker leg first, followed by the stronger leg. Common fall hazards in the home. Environmental hazards: loose rugs or mats, wet floors, dim lighting, unstable furniture, cluttered walkways. Personal risk factors: muscle weakness or joint stiffness, medications causing drowsiness or dizziness, poor vision, unfitted footwear, cognitive impairment, e.g., dementia. Fall prevention strategies. Home modifications. Use grab bars in bathrooms. Install night lights. Keep floors dry and clutter-free. Arrange furniture to allow wide pathways. Ensure assistive devices are properly adjusted. Client-specific interventions. Encourage daily mobility to build strength. Monitor for medication side effects. Ensure hydration and nutrition to prevent weakness. Report any changes in balance or coordination to the nurse. What to do if a fall occurs. Do. Stay calm. Check for injuries before moving the client. Call for emergency help or the supervising nurse if needed. Comfort and reassure the client. Do not attempt to lift the client alone. Move them without assessing for pain, fractures, or consciousness. Blame the client or make them feel embarrassed. Document the fall in accordance with agency policy and include time and place of fall, description of incident, client's condition, actions taken. Reporting and documentation. Always report and document any difficulties during ambulation: dizziness, weakness, or refusal to walk, new use of furniture for support, observed hazards in the home, signs of bruising, limping, or altered gait. Accurate documentation ensures client safety and allows for adjustments to the care plan. This lesson focused on safe ambulation support that promotes mobility and confidence. Ambulation is about encouraging independence and ensuring safety. Proper support helps reduce fall risks and improve mobility. HHAs play a vital role in a client's quality of life. Every step guided with care builds confidence and security. With each step, HHAs help clients stay active, safe, and independent. Making an occupied bed. As a home health aide, HHA, providing a clean, safe, and comfortable environment for your client is essential to their well-being. One of the most important daily tasks in home care is making an occupied bed, changing bed linens while the client remains in the bed. This skill promotes client comfort, supports infection control, and protects the client's dignity and safety, especially for those who are bedridden or have limited mobility. In this lesson, you'll learn how to safely and effectively make an occupied bed using proper body mechanics and infection control practices. When and why to make an occupied bed. When it's necessary, the client cannot safely get out of bed, during routine morning or evening care, after episodes of incontinence, perspiration, or spills, to promote cleanliness and comfort. Why it matters. Prevents skin irritation and pressure injuries, maintains dignity and comfort, reduces germs, and promotes infection control, encourages a clean, organized environment. Supplies and preparation. Supplies needed: clean bottom sheet, fitted or flat, clean top sheet, pillowcases, blanket or bedspread, waterproof pad or bed protector, if needed, disposable gloves for hygiene, laundry hamper or bag, preparation steps. Wash your hands. Explain the procedure to the client to gain cooperation. Gather all supplies before beginning. Check the bed height and lock wheels for safety. Put on gloves if handling soiled linens or bodily fluids. Step by step, making an occupied bed. Position the client safely. Help the client turn onto their side, facing away from you. Ensure the side rail, if available, on the opposite side is raised. Tuck a privacy blanket over the client to maintain dignity. Remove soiled linens, one side at a time. Loosen the bottom linens and roll them inward toward the client's back. Tuck the rolled linens under the client. Avoid shaking linens to reduce the spread of germs. Place clean linens, same side. Place the clean bottom sheet on the exposed mattress. Tuck the corners and sides neatly. Roll the clean sheet toward the client and tuck it under the soiled linens. Reposition the client. Gently roll the client onto their back, then over the hump of clean soiled linens to the other side. Raise the opposite side rail, if available, and move to the other side. Remove and replace linens, second side. Remove the soiled linens and place them directly in the laundry hamper. Pull through and secure the clean linens, tucking in all sides smoothly to avoid wrinkles. Add top sheet and blanket. Ask the client to hold or tuck the top sheet under the blanket while removing the old one. Place the clean blanket and top sheet over the client, then adjust and tuck at the foot of the bed. Change the pillowcase. Gently support the client's head and remove the old case. Insert the pillow into a clean pillowcase without shaking it. Position the pillow comfortably behind the client's head. Infection control and safety tips. Always wash hands before and after the procedure. Wear gloves when handling soiled linens or bodily fluids. Avoid placing dirty linens on the floor or other surfaces. Keep bed wrinkle-free to prevent skin breakdown. Use proper body mechanics. Raise the bed and bend your knees, not your back. Respect the client's privacy and modesty at all times. Documentation and communication. After completing the task, document the time the bed was changed. Note any soiling, skin breakdown, or unusual odors. Report anything concerning to the supervising nurse. Effective documentation ensures continuity of care and early detection of potential problems. This lesson highlighted how occupied bedmaking supports hygiene, comfort, and professional care. Making an occupied bed is a clinical skill, not just a cleaning task. It reflects professionalism, respect, and client attentiveness. Helps prevent skin complications and maintain hygiene. Improves client comfort and satisfaction. Mastery boosts HHA confidence and care quality. A well-made bed promotes client dignity and reflects skilled, attentive caregiving. Positioning and turning clients. In home care, frequent positioning and turning are essential for maintaining a client's comfort, circulation, respiratory function, and skin integrity, especially for clients with limited mobility or who are bedridden. This lesson will teach you how to safely and properly position and turn clients to support health outcomes and prevent complications such as contractures, respiratory issues, and pressure injuries. As a home health aide, HHA, you play a crucial role in ensuring that these tasks are done consistently and correctly. Understanding the importance of proper positioning. Why it matters. Promotes good circulation and reduces risk of blood clots. Supports lung expansion and easier breathing, prevents muscle stiffness and joint contractures, reduces risk of pressure injuries, bed sores, enhances digestive and urinary function. Frequency of turning. For clients who are bedridden or immobile, turn them at least every 2 hours. Turning schedules may vary based on individual care plans. Common client positions and their purposes. Supine position, on back, used for resting and sleeping. Legs extended, arms at sides, or slightly elevated. Use pillows under head, arms, and calves to reduce pressure. Lateral position, side lying, used for turning and pressure relief on the back. Support pillows placed under head, upper arm, back, and between knees. Prone position, on stomach. Less common, may be used for certain respiratory needs. Place pillows under abdomen, shins, and head if needed. Fowler's position, semi-sitting, used for eating, breathing, or watching TV. High Fowlers, 60, 90 degrees, or semi-Fowlers, 30-45 degrees. Support back and knees with pillows if needed. Sims position, semi-prone, used for enemas, rectal exams, or unconscious clients. Lying on left side with right knee bent, supported by pillows. How to safely turn a client in bed. Preparation. Wash hands and put on gloves if necessary. Explain the procedure to the client. Ensure the bed is locked and at waist level. Position the bed flat unless contraindicated. Step by step. Turning a client side to side. Stand on the side the client will be turned toward. Gently move the client's head, shoulders, hips, and legs toward you as one unit, log rolling if necessary. Cross the client's arm and leg on the far side over their body. Roll the client toward you using the draw sheet or by gently guiding their hip and shoulder. Support with pillows behind the back, under the top arm, and between the knees ankles. Tip. Never pull on the client's arms or legs. Use proper body mechanics and always bend your knees. Safety and comfort considerations. Check for lines, tubes, or catheters before moving the client. Always communicate before and during the turn. Ensure side rails are up on the side the client is turning toward, if used. Use a draw sheet to reduce friction and protect skin. Assess for redness, swelling, or discomfort after turning. Ensure the client is comfortable and aligned before leaving. Documentation and communication. After each positioning or turning session, document time of repositioning, position placed in, any skin changes or complaints of pain. Report any abnormalities to the supervising nurse. Clear documentation helps with tracking pressure relief routines and supports care continuity. This lesson covered the importance of safe, compassionate positioning and turning. Positioning and turning are acts of clinical care and compassion. Frequent, safe repositioning prevents serious complications, supports client comfort, dignity, and quality of life. Mastering this skill ensures essential physical support in home care. Proper repositioning protects health, preserves dignity, and enhances quality of care. Use of transfer belt gait belt. When assisting clients with mobility, your technique and tools can mean the difference between safety and injury for both you and the client. One of the most essential tools in home care is the transfer belt, also known as a gait belt. This lesson will focus entirely on the purpose, correct usage, safety guidelines, and common errors related to gait belts. Proper use can increase client confidence, maintain dignity, and reduce the risk of falls or strain during walking or transfers. What is a transfer belt gait belt? A gait belt is a sturdy, belt-like device made of canvas, nylon, or leather that wraps around the client's waist and fastens securely. It provides a handhold for caregivers to safely assist clients with standing, walking, or transferring. When it's used, assisting clients to stand up from a bed or chair, supporting safe ambulation walking, transferring clients from bed to chair or vice versa, helping stabilize clients with limited balance or strength. Who should not use a gait belt? Clients with abdominal wounds, tubes, colostomies, or recent surgeries. Clients who are completely dependent, require mechanical lift instead. Those who refuse or are combative. Always check the client's care plan or consult the supervising nurse if unsure. Equipment check and safety precautions. Before using a gait belt, always perform the following. Inspect the belt. Ensure the belt is clean, free of tears, and properly fastened. Check for functioning buckles, metal teeth, or clip. Safety first. Wash your hands before and after the procedure. Ensure the client is wearing non-slip shoes. Clear the area of obstacles and trip hazards. Explain the procedure to the client to reduce anxiety. Ask permission before applying the belt. How to apply the gait belt. Step-by-step instructions. Position the belt around the client's waist over their clothing, not directly on the skin. Tense the belt so it's secure but not uncomfortable. You should be able to slide 2 fingers under the belt. Position the buckle at the front or slightly off-center, never directly on the spine. Tuck any excess strap securely into the belt loop or out of the way. Do not place the belt over medical devices, wounds, or fragile skin. Techniques for walking and transferring with a gait belt. Assisting with walking ambulation. Stand slightly behind and to the side of the client. Hold the belt firmly from underneath, not over the top. Use your dominant hand to grasp the belt and the other hand to support or steady. Walk at the client's pace, offering encouragement and balance support. Assisting with transfers, e.g. bed to chair, have the client scoot to the edge of the bed or chair. Stand with your feet, shoulder width apart, knees bent, and back straight. Count aloud, 1, 2, 3, and help the client stand using a rocking motion. Support with the belt while pivoting the client toward the new surface. Help the client sit slowly and safely, using controlled guidance. Common mistakes to avoid. Grabbing the client's arms instead of using the belt. Placing the belt too high or too loose. Twisting your back instead of bending knees during a transfer. Forgetting to check for medical restrictions. Leaving the belt on after transfer, it should be removed. Documentation and observation. After assisting a client with a gait belt, always document time of ambulation or transfer, distance walked or activity completed, client's tolerance, comfort, or any signs of dizziness, fatigue, or instability, any unexpected occurrences, for example, near fall, refusal. Report concerns like new unsteadiness, shortness of breath, or complaints of pain to the supervising nurse immediately. This lesson introduced the gait belt as a key tool for safe, supported mobility. The gait belt supports mobility, independence, and safety. Proper use reduces fall risks and protects caregivers from injury, boosts client confidence, and supports those with balance issues. Mastery is essential for all HHAs working with mobility-limited clients. Always follow safety protocols and communicate clearly. Used correctly, the gait belt protects both client and caregiver, while building confidence with every step. Taking temperature, pulse, and respirations. Monitoring vital signs is a key responsibility of a home health aide. These measurements, temperature, pulse, and respirations, give insight into a client's current health and help detect problems early. In this lesson, you'll learn how to accurately take and record these 3 vital signs using proper techniques, infection control, and observation skills. Understanding body temperature. What is body temperature? Body temperature reflects the body's ability to generate and release heat. A normal adult body temperature typically ranges from 97 degrees Fahrenheit to 99 degrees Fahrenheit, 36.1 degrees Celsius to 37.2 degrees Celsius. Sites for measuring temperature: oral, under the tongue; axillary, under the armpit; tympanic, in the ear; temporal, forehead using scanner; rectal, rarely done by HHAs, use only if directed and trained. Always follow the care plan and your agency's policy for method selection. Equipment: digital thermometer, most common; tympanic or temporal thermometer; disposable probe covers to prevent cross-contamination. Procedure: taking an oral temperature. Wash your hands and wear gloves if needed. Make sure the client hasn't had anything hot or cold to eat drink in the past 15 minutes. Place a probe cover on the thermometer. Insert it gently under the tongue and instruct the client to close their lips. Wait for the beep and remove it to read the result. Dispose of the cover, document the result, and report any abnormal readings. Taking a pulse. What is a pulse? A pulse is the rhythmic throbbing felt as blood is pumped through the arteries. It reflects the heart rate and rhythm. Normal adult pulse, 60 to 100 beats per minute, BPM. Pulse sites used by HHAs. Radial pulse, inside the wrist, thumb side. Apical pulse, chest, usually assessed by nurses. Procedure: taking a radial pulse. Ensure the client is calm and at rest. Place your first 2 fingers, not your thumb, on the radial artery. Press gently until you feel the pulse. Count the beats for 60 seconds or 30 seconds and multiply by 2 if regular. Note the rate, rhythm, regular, irregular, and strength, strong, weak. Document and report any irregularities. Never use your thumb. It has its own pulse and can cause error. Measuring respirations. What are respirations? Respirations are the number of times a person inhales and exhales in 1 minute. It reflects how well the lungs are functioning. Normal adult respiratory rate, 12 to 20 breaths per minute. How to count respirations. Watch the rise and fall of the chest. Each rise and fall, 1 breath. Count for 60 seconds. Tips for accurate observation. Do not tell the client you're measuring respirations. They may change their breathing. Instead, take the pulse first and then immediately observe respirations discreetly. Report labored, shallow, noisy, or unusually fast, slow breathing immediately. Documentation and when to report. Always document temperature with method used, e.g., oral, pulse rate, rhythm, and strength, respiratory rate, and any unusual signs. Report to the nurse if temperature is below 97 degrees Fahrenheit or above 100.4 degrees Fahrenheit. Pulse is less than 60 or more than 100 BPM or irregular. Respirations are less than 12 or more than 20 per minute. The client appears short of breath, pale, or confused. Clear and timely reporting ensures client safety and helps the healthcare team respond to problems early. Accurately taking and reporting temperature, pulse, and respirations is critical. These signs give a clear picture of how the client is doing. Staying observant and careful ensures you follow protocol. You protect the life and health of the people you care for. Your attention to detail helps protect your client's well-being. Measuring blood pressure, manual and digital. Blood pressure, BP, is a critical indicator of heart and circulatory system health. For home health aides, HHAs, accurately measuring blood pressure and knowing when to report abnormal readings is essential. In this lesson, we'll cover both manual and digital methods of measuring blood pressure, how to prepare the client, correct positioning, and when to alert a nurse or supervisor. Understanding blood pressure. What is blood pressure? Blood pressure is the force of blood pushing against the walls of the arteries as the heart pumps. It is recorded as 2 numbers: systolic, top number, pressure when the heart contracts; diastolic, bottom number, pressure when the heart rests between beats. For example, 120 over 80 mmHg, read as 120 over 80, is considered normal for a healthy adult. Normal blood pressure range: normal, less than 120 over 80 mmHg. Elevate, 120 to 129, less than 80 mmHg. Hypertension, high BP, 130 over 80 mmHg or higher. Hypotension, low BP, less than 90/60 mmHg. Equipment for blood pressure. Manual BP tools. Sphygmomanometer, aneroid gauge plus cuff. Stethoscope. Digital BP monitor. Electronic device that automatically inflates and records BP. Use the method specified in the care plan or as directed by your supervisor. Preparing the client. Proper preparation ensures accuracy. Ensure the client is seated or lying down comfortably. Arms should be supported at heart level, palm facing up. Make sure the client has rested at least 5 minutes beforehand. Remove tight clothing or roll sleeves up. Don't over-tighten. Explain what you're going to do to reduce anxiety. Avoid taking BP on the side of mastectomy, IV line or dialysis shunt, injury or weakness. Manual blood pressure measurement. Step-by-step procedure. Wash your hands and clean equipment. Wrap the cuff snugly around the upper arm, 1 inch above the elbow. Place the stethoscope over the brachial artery, inside elbow. Close the valve and inflate cuff to 160 to 180 millimeters mercury or 30 millimeters mercury above expected systolic pressure. Slowly release the air, 2 to 3 millimeters mercury per second. Listen for first sound, systolic pressure. Last sound before silence, diastolic pressure. Record the reading, e.g., 118/76 millimeters mercury. Remove cuff, clean equipment, and wash hands. Document and report any abnormal readings. Tip: if you can't hear clearly, wait a few minutes and try again. Digital blood pressure measurement. Using a digital monitor. Wash your hands and clean the machine if needed. Wrap the cuff according to device instructions. Ensure the client's arm is at heart level and relaxed. Press start and allow the machine to inflate and read. Wait for the final reading to appear. Remove the cuff and document the systolic, diastolic numbers and pulse. Turn off the device and clean if necessary. Digital monitors are convenient, but may be less accurate if the client is moving or has an irregular heart rhythm. Documentation and when to report. What to record: BP reading, e.g., 122/78. Method used: manual or digital. Arm used: left-right. Client's position: sitting, lying, standing. When to report to the nurse. Systolic is below 90 or above 140. Diastolic is below 60 or above 90. Client complains of dizziness, headache, or chest pain, irregular rhythm, or difficulty obtaining BP. Device malfunctions. Always follow your agency's protocols when reporting abnormal findings. Accurately measuring blood pressure is a vital skill for any home health aide. Your technique, attentiveness, and documentation all contribute to effective client care. Monitoring changes in BP helps detect early warning signs of serious health conditions, ensures your clients stay safe and healthy. Accurate blood pressure readings help detect early health risks. Your skill and attention keep clients safe and support better care. Recording weight and height. Accurate weight and height measurements are more than just numbers. They are essential indicators of a client's overall health. They assist with medication dosing, monitoring nutritional status, and identifying significant health changes over time. As a home health aide, HHA, your role in properly measuring and documenting these values is crucial to the care team's ability to deliver safe and effective care. Understanding the importance of measuring weight and height. Why these measurements matter. Detecting health changes. Sudden weight gain, loss, can signal fluid retention, malnutrition, or disease progression. Medication dosing. Many medications are calculated based on body weight. Nutritional status helps monitor effectiveness of dietary plans or feeding regimens. Growth monitoring, especially important for children or clients with developmental concerns. Fall risk and equipment sizing helps determine appropriate assistive devices like wheelchairs or transfer aids. Equipment used. Weight measurement tools, standing scale with or without height rod, chair scale for non-ambulatory clients, wheelchair scale, bed scale for completely immobile clients. Height measurement tools, stadiometer attached to standing scale. Measuring tape for bedridden clients. Always check that equipment is clean, calibrated, and functioning properly before use. Measuring height. Ambulatory clients. Step-by-step guide. Explain the procedure to the client to reduce anxiety. Ensure the client removes shoes, hats, and bulky hairstyles. Have the client stand straight with heels against the wall or stadiometer. Lower the measuring bar until it rests lightly on the top of the head. Read the measurement at eye level and note it in inches or centimeters. Document and report per agency protocol. Measuring weight. For standing clients, ensure scale is zeroed before starting. Ask the client to remove heavy clothing and shoes. Stand still and centered on the scale platform. Read and record the measurement in pounds, LPNs, or kilograms, kg. Assist off the scale and ensure safety. For seated or non-ambulatory clients, use a chair scale or wheelchair scale. Weigh the wheelchair alone first, if needed. Subtract the wheelchair weight from the total weight for accurate reading. For bedbound clients, use a bed scale. Ensure all items, blankets, pillows, are weighed consistently. Zero the scale before weighing each time. Proper documentation. What to record, date and time of the measurement, exact weight and height with units, method used, e.g., standing scale, bed scale, any observations, e.g., client had difficulty standing or was anxious, when to report, rapid weight gain, e.g., 2 pounds in 24 hours in cardiac clients, sudden weight loss or refusal to be weighed, inability to obtain measurement, equipment failure, uncooperative client. Always follow your facility's policies and notify the nurse or supervisor of abnormal results. Special considerations. Weighing at the same time daily, preferably in the morning before meals and after using the bathroom. Using the same scale, under the same conditions. Cultural sensitivity. Be respectful if clients are uncomfortable removing clothing or being touched. Offer privacy and explain each step before you proceed. Safety first. Lock wheelchairs and assistive devices. Use proper body mechanics and ask for help if needed. Recording a client's weight and height is a skill that holds high clinical value. When done consistently and accurately, it provides vital clues to a client's health status. Helps the healthcare team make informed decisions. Your attention to detail and professionalism can make a meaningful difference in someone's care. Accurately recording a client's weight and height provides vital health information. Your accuracy and professionalism help the healthcare team make informed decisions and improve client care. Documenting and reporting to supervisor. As a home health aide, HHA, you are the eyes and ears of the care team in the client's home. One of your most important responsibilities is accurate documentation and timely reporting of what you observe. Whether it's changes in a client's condition, vital sign trends, or behavioral issues, your records guide the nurse and other healthcare professionals in making clinical decisions. This lesson teaches how to document clearly and when to report to your supervisor, two critical tasks in delivering safe and effective care. Understanding the purpose of documentation, why documentation matters, creates a legal record of care provided, tracks changes in condition over time, ensures continuity of care across providers, protects both the client and the HHA in case of disputes, helps supervisors and nurses respond quickly to any concerns. Examples of documented information. What care was provided? Example, assistance with bathing, meals. Client's appearance, mood, or complaints. Abnormalities such as skin redness, refusal to eat, or dizziness. Vital sign readings if applicable. Any incidents, falls, missed medication, etc. Guidelines for accurate documentation. Basic documentation tips. Write clearly and legibly, if using paper forms. Use blue or black ink, no pencil or whiteout. If correcting an error, draw one line through it, write error, initial, and rewrite correctly. Follow your agency's format, paper chart or electronic system. Use objective language. Report what you see, hear, or measure, not assumptions. Client stated, "I feel dizzy." Client is probably dehydrated. Avoid judgmental language like lazy, angry, or complaining. Include date and time of entry, what you did and what the client said or did in response, your initials or signature, as required by policy. What to report to your supervisor. Not everything is an emergency, but certain findings must always be reported. These include urgent medical issues or anything that could affect the client's health or safety. Examples of when to report immediately. Vital signs are abnormal for the client, for example, high fever, fast heart rate. New symptoms, pain, swelling, bleeding, shortness of breath. Changes in behavior, confusion, agitation, withdrawal. Refusal of care or medication. Signs of abuse or neglect. Fall or injury, even if the client says they're okay. How to report. Call or message your supervisor according to agency protocol. Use SBAR format if taught. Situation. What is happening now? Background. What is the relevant client history? Assessment. What do you think is wrong? Recommendation. What do you need or suggest? Weekly and as-needed reporting. Daily reports typically include assistance provided, example grooming meals, client's mood, mobility, eating habits, any complaints or comments by the client. Weekly or routine reports, weight measurements, progress on care goals, fluid intake logs, cleaning supplies needed, gloves, linens, etc. As needed, PRN reports, any out-of-the-ordinary changes, requests from the client that go beyond your duties, issues in the home environment, lack of heating, cleanliness concerns. Confidentiality and legal considerations. Keep information private. Share client information only with those who need to know, such as your nurse supervisor or care team. Do not leave documentation lying around or discuss client issues with friends or on social media. Documentation is a legal record. In legal cases, your notes can be used as evidence. Inaccurate or false documentation can lead to serious legal and job consequences. Your observations and notes are the foundation of safe and effective home care. Your documentation and communication with your supervisor ensure that every client receives the care they need. Mastering these skills protects your clients and demonstrates your professionalism and reliability as a healthcare team member. Accurate notes and clear communication protect your clients and support safe, effective care. By mastering these skills, you demonstrate professionalism and help ensure every client receives the care they need. Housekeeping laundry, linens and trash disposal. In the home health setting, maintaining a clean and safe environment is essential to a client's comfort and health. As a home health aide, HHA, your responsibilities may include light housekeeping tasks, especially those directly related to the client's care. This lesson focuses on 3 vital areas: laundry care, linen changes, and safe trash disposal. Mastering these tasks promotes infection control, prevents skin problems, and enhances a client's sense of dignity and well-being. Laundry responsibilities. General guidelines. Always follow the client's preferences and care plan instructions. Sort laundry by color, fabric type, and washing instructions. Check labels. Use unscented, mild detergent if the client has sensitive skin or allergies. Wear gloves when handling soiled laundry. Steps for safe laundry handling. Sort clothes, whites, colors, delicates. Pre-treat stains. Use stain remover if allowed and test fabric first. Use proper settings. Cold water for dark colors, hot for whites or heavily soiled items, unless otherwise directed. Dry properly. Air dry delicate items when needed. Fold or hang clothing neatly and store them in the proper place. Special considerations. Incontinent clients. Soiled items should be handled with gloves and laundered separately. Infectious waste. Wash separately using the hottest water appropriate and add disinfectant. Follow agency policy. Changing and handling linens. When to change linens, at least once a week or more frequently if soiled, damp, or wrinkled. Immediately after any incontinence episode, bleeding, or spills. When client requests or seems uncomfortable. How to change bed linens. Wash hands and wear gloves. Loosen linens from the bed while the client is in a safe position. Roll used linens inward to contain contaminants. Place soiled linens in the designated laundry bag, never on the floor. Apply clean fitted sheet, followed by top sheet, blanket, and pillowcase. Ensure no wrinkles to prevent pressure injuries. Offer comfort by checking pillow support and blanket coverage. Safety tips. Always lock wheels of the bed if hospital type. Keep side rails up if the client is at risk of falling. Do not shake linens, which can spread germs. Trash and waste disposal. Types of waste you may handle. Regular household trash, for example, food wrappers, tissues. Medical waste, for example, used gloves, wound dressings, incontinent briefs. Disposal process. Wear gloves when handling any trash, especially medical waste. Use separate bags for regular versus contaminated waste. Place waste in tied, leak-proof plastic bags. Dispose immediately, never leave full bags in the client's room or kitchen. Follow agency protocol for any sharps disposal, usually not the HHA's duty, but know what to avoid. Odor control and cleanliness. Remove trash daily or more often if it contains food or waste. Wipe trash bins with disinfectant regularly. Always wash hands after removing gloves and trash. Promoting a clean and comfortable environment. Even small tasks contribute significantly to client well-being. Many clients feel vulnerable, depending on others to maintain their home. By keeping their living areas clean, you help promote mental wellness, reduce infection risk, and show respect for their dignity. Key habits. Tidy up as you go. Don't wait until the end of your shift. Always ask permission before throwing out personal items. Provide choices. Ask, "Would you like fresh sheets today?" Or, "Would now be a good time to take care of laundry?" Laundry, linens, and trash disposal are essential for a safe and sanitary home care environment. A home health aide's attention to detail supports both infection control and client comfort. Proper procedures and consistency make you a trusted and effective member of the caregiving team. Proper laundry, linen care, and trash disposal keep the home safe and sanitary. Your attention to detail supports infection control and client comfort, making you a trusted and reliable member of the care team. Safe meal preparation and storage basics. Nutrition and food safety are essential components of home care. As a home health aide, HHA, you may be responsible for preparing meals and storing food for clients, many of whom are elderly or have chronic illnesses that make them more vulnerable to foodborne illnesses. This lesson focuses specifically on the principles of safe meal preparation, food handling hygiene, and proper food storage practices to promote client health and safety in the home setting. Principles of safe meal preparation. Hand and kitchen hygiene. Wash your hands before and after preparing meals. Use clean utensils, cutting boards, and kitchen surfaces. Wash fruits and vegetables thoroughly. Do not prepare food if you are sick or have open wounds, preventing cross-contamination. Keep raw meat separate from ready-to-eat foods. Use separate cutting boards for raw meat and produce. Sanitize all surfaces after contact with raw animal products. Never place cooked food on plates that held raw food. Cooking temperatures. Use a food thermometer to ensure foods are cooked to safe internal temperatures. Chicken and poultry. 165 degrees Fahrenheit, 74 degrees Celsius. Ground meat. 160 degrees Fahrenheit, 71 degrees Celsius. Fish. 145 degrees Fahrenheit, 63 degrees Celsius. Leftovers. Reheated to 165 degrees Fahrenheit, 74 degrees Celsius. Proper cooking kills harmful bacteria and viruses that can make clients sick. Proper food storage guidelines. Refrigerator and freezer safety. Keep refrigerator at or below 40 degrees, 4 degrees Celsius. Keep freezer at 0 degrees Fahrenheit, -18 degrees Celsius, or below. Store raw meat on bottom shelves to prevent drips onto other foods. Food storage time frames. Food item, safe fridge storage time, cooked leftovers, 3 to 4 days. Raw poultry, 1 to 2 days. Ground meat, 1 to 2 days. Eggs, raw, in shell, 3 to 5 weeks. Milk, 5 to 7 days. After opening, check expiration dates and follow the first in, first out rule. Use older items first. Labeling and dating. Label all stored food with date prepared or opened. Use airtight containers to preserve freshness. Discard any food with unusual odor, color, or texture. Food safety risks and how to prevent them. Common foodborne illness symptoms: nausea, vomiting, diarrhea, fever, abdominal cramps. Older adults and immunocompromised clients may experience more severe reactions. Avoiding high-risk foods for vulnerable clients. For clients with weak immune systems, avoid raw eggs, foraged nearly in homemade mayonnaise, unpasteurized dairy products, deli meats unless reheated to steaming hot, raw sprouts or sushi. What to do if contamination is suspected? Discard questionable food immediately. Do not serve it to the client just in case. Report food-related illness signs to the nurse or supervisor right away. Grocery planning and meal prep tips. Client-centered meal planning. Respect the client's dietary restrictions, preferences, and cultural food practices. Follow any dietary instructions from nurses, dietitians, or physicians. Smart shopping practices. Check expiration dates at the store. Bag raw meats separately to avoid leaks. Prioritize fresh, nutrient-rich foods when possible. Cooking in advance. Prepare meals in portions if allowed, storing them properly for reheating. Reheat leftovers only once and discard uneaten portions after 2 days. Careful attention to food safety and preparation can prevent illness and support nutritional needs. You play a critical role in maintaining a clean and healthy home environment. Follow hygienic cooking practices, store food properly, and monitor expiration dates. Remember, when in doubt, throw it out. Food safety is never worth the risk. Safe food handling protects your client's health and meets their nutritional needs. By following hygienic cooking practices, proper storage, and checking expiration dates, you create a safer home environment. Client environment safety, rugs, lighting, appliances. Maintaining a safe home environment is a vital responsibility of the Home Health Aide, HHA. Many clients are older adults or individuals with mobility issues, poor vision, or chronic conditions that increase their risk of injury. This lesson will guide you through identifying and correcting potential hazards in the home, especially those related to rugs, lighting, and appliances. A safe environment promotes independence, reduces falls, and gives peace of mind to both clients and families. Rug safety, slips, trips, and falls. Common rug hazards: loose rugs that slide on floors, rug edges that curl or lift, bulky or uneven rugs that catch mobility aids like walkers. Best practices for rug safety: remove small area rugs when possible. Use non-slip rug pads or tape underneath rugs that must stay. Replace worn-out rugs that are torn or frayed. Avoid placing rugs at doorways or at the top of stairs. Client education tip: gently explain to clients that some decorative items, like throw rugs, can pose serious risks. Offer safe alternatives, such as low-profile mats with rubber backing. Proper lighting. Seeing is safety. Risk of inadequate lighting. Dim hallways or stairways may cause missed steps or tripping. Poor lighting makes it hard for clients to see obstacles on the floor. Key areas that require good lighting: entrances and exits, bathrooms, staircases, kitchens and medication areas, pathways between rooms, especially at night. Safety tips: use nightlights in hallways, bedrooms, and bathrooms. Replace burned-out bulbs promptly. Encourage automatic sensor lights where possible. Keep flashlights available during power outages. Appliance safety, preventing fires and injuries. Assessing appliance risks: frayed cords, broken plugs, or unsteady devices. Overloaded outlets or extension cords. Unattended use of heaters or stovetops. Toasters, microwaves, or coffee makers near flammable materials. Safe appliance practices: check all cords and plugs for damage. Unplug unused appliances. Keep appliances away from wet areas, especially in kitchens or bathrooms. Ensure space heaters are placed safely, away from beds, curtains, or rugs. Never leave cooking appliances on and unattended. Client consideration: always ask before moving or unplugging a client's belongings. If something appears unsafe, report it to your supervisor and discuss it with the client kindly and respectfully. General environment safety checks. Daily safety observations. Are walkways clear of cords, clutter, or pets? Is the bathroom dry and non-slippery? Are furniture items stable and easy to grab for support? Are emergency numbers visible and easily reachable? Emergency preparedness. Know where fire extinguishers and first aid kits are located. Identify exit routes in case of emergency. Make sure smoke and carbon monoxide detectors are working. A clean home is good, but a safe home is essential. Your daily awareness of rugs, lighting, and appliance risks can protect your client from serious injury. Proactively identifying dangers and working with clients and supervisors helps keep the home secure and functional. Ensures the home is a space for healing and independence. A safe home prevents accidents and supports independence. By staying alert to hazards and addressing risks, you help create a secure, functional space where clients can heal and thrive. Emergency response, falls, fire, medical events. As a home health aide, HHA, you are often the first person present when an emergency occurs. Your ability to recognize signs of danger, respond quickly, and remain calm can make a life-saving difference. This lesson covers how to handle 3 major types of emergencies in a home care setting: falls, fires, and medical events, such as stroke or breathing difficulty. You'll learn how to react appropriately, follow care plans, and communicate effectively with supervisors and emergency personnel. Responding to falls. What to do if a client falls. Stay calm. Reassure the client and avoid sudden movements. Do not move the client unless there is immediate danger. Example, fire. Check for injuries. Ask if the client is in pain. Observe for swelling, bleeding, or deformity. Call for help. Notify your supervisor immediately. Call 911 if needed. Example, if the client is unconscious or injured. After the fall, document exactly what happened, including time and location of the fall, what the client was doing, any visible injuries or complaints, actions you took. Help comfort the client and wait with them until help arrives. Prevention tip: never try to lift a fallen client alone. Doing so could injure both you and the client. Wait for trained help. Fire emergencies. Immediate actions. Assess the situation. Is there smoke, flames, or heat? Is it safe to evacuate the client? Activate emergency response. Call 911. Pull a fire alarm if available. Evacuate safely if possible. Assist the client using a safe route. Stay low to the ground to avoid smoke. Never use elevators during a fire. Key fire safety principles: RACE, R, rescue, move clients away from danger. A, alarm, call for help or activate the fire alarm. C, contain, close doors behind you to slow the fire. E, extinguish, use a fire extinguisher only if trained and safe to do so. Know your environment, be familiar with exit locations, fire extinguishers, smoke detectors, emergency contact numbers. Medical events: stroke, seizure, difficulty breathing. Stroke, think fast. F, face drooping. A, arm weakness. S, speech difficulty. T, time to call 911. If you see any of these signs, act immediately and call emergency services. Keep the client safe and in a comfortable position. Do not give them anything to eat or drink. Seizure, do not restrain the client. Protect the head with a pillow or soft item. Move objects away to prevent injury. Time the seizure if possible. After it ends, place client in recovery position, on their side. Call 911 if seizure lasts more than 5 minutes. It's the client's first seizure. Client is injured or does not regain consciousness. Difficulty breathing or chest pain. Stay with the client. Help them sit upright to ease breathing. Loosen tight clothing. Call 911 immediately. Do not leave the client alone or attempt to diagnose the issue. Communication and reporting. When to call for help. Always notify 911 in life-threatening situations, your supervisor as soon as possible, the client's family if required by agency policy. Accurate reporting includes time the event occurred, what happened before, during, and after, What you observed, symptoms, behavior, what actions you took, names of people you contacted. Keep calm, clear, and concise. Your detailed report helps the care team respond effectively. Emergencies can happen at any time, and as a home health aide, your response matters. Calm thinking, preparation, and communication can protect lives. Always follow your agency's emergency protocols and trust your training. Never hesitate to call for help when in doubt. Your role is not to diagnose, but to respond quickly and appropriately. Emergencies can happen anytime, and your quick, calm response can save lives. Follow protocols, trust your training, and call for help when needed. Your actions make all the difference. Communicating with clients and families. Effective communication is the foundation of quality home care. As a home health aide, HHA, you are a trusted presence in the client's home and often serve as a bridge between the client, their family, and the broader healthcare team. This lesson focuses on how to communicate clearly, respectfully, and professionally with both clients and their families, building trust and understanding in every interaction. Foundations of effective communication. What is communication? Communication involves sending and receiving information. It includes verbal communication, spoken words, nonverbal communication, body language, facial expressions, tone of voice. Characteristics of effective communication. Clarity. Use simple, understandable language. Respect. Show kindness and patience. Active listening. Pay full attention, show interest, and ask questions. Empathy. Understand the feelings and perspectives of others. The HHA's role. Deliver messages clearly to the client and family. Report observations to the supervisor accurately. Maintain a calm and reassuring tone, especially when clients are anxious or upset. Active listening techniques. What is active listening? Active listening is more than hearing. It's showing the speaker they have your full attention. This builds trust and helps prevent misunderstandings. Key active listening strategies. Make eye contact. Nod or give small verbal cues like, "I see," or "Go on." Do not interrupt. Restate or paraphrase to confirm understanding. For example, "So you're saying." Avoid these common mistakes. Looking distracted, e.g., checking your phone. Finishing the client's sentence. Ignoring nonverbal cues, for example, a frown or silence. Verbal communication with clients. Tips for speaking with clients. Use a friendly and respectful tone. Address clients by their preferred name, e.g., Mr. Lopez, Ms. Green. Speak slowly and clearly, especially with older adults. Ask open-ended questions to encourage conversation, e.g., "How are you feeling today?" Handling difficult conversations. Stay calm if the client is upset. Avoid arguing or correcting harshly. Use reassuring statements like, "I understand this is frustrating. Let me see how I can help." Communicating with family members. Why it matters. Family members are often involved in the client's care and need updates, reassurance, and cooperation. Your communication with them reflects your professionalism and respect for the client's support system. Do. Be respectful and polite. Share only appropriate information based on agency policy and client privacy. Listen to concerns and take them seriously. Refer clinical questions to the nurse or supervisor. Don't. Share your personal opinions or frustrations. Make promises outside your scope, e.g., "I'll change the medication." Discuss other clients or confidential matters. Maintaining boundaries and privacy. Professional boundaries. Maintain a professional relationship, not a friendship. Do not share your personal problems or opinions. Respect the client's personal space and values. Confidentiality. Never discuss the client's health or personal life with others. Follow HIPAA guidelines, Health Insurance Portability and Accountability Act. If unsure what to share, ask your supervisor. Communication challenges and solutions. Clients with hearing impairments. Face the client and speak clearly. Reduce background noise. Use written notes if needed. Clients with cognitive impairment or dementia. Use simple, short sentences. Speak slowly and with a calm tone. Repeat or rephrase gently if not understood. Language barriers. Use an interpreter when needed. Follow agency policy. Speak clearly. Avoid slang or idioms. Use gestures or pictures to support your message. Strong communication is not just about talking, it's about connecting. Your ability to listen actively, speak clearly, and respect boundaries is vital to building trust and ensuring quality care. Your words and actions can make a meaningful difference. Always communicate with compassion, professionalism, and a focus on the client's dignity. Strong communication builds trust and supports quality care. By listening actively and speaking with respect and compassion, you make a meaningful difference in every client's life. Listening skills and respecting cultural differences. In a diverse and increasingly multicultural society, home health aides, HHAs, must master not only strong listening skills, but also cultural sensitivity. This lesson explores how effective listening fosters trust and how recognizing and respecting cultural differences can improve communication and care outcomes. As a caregiver in someone's home, your awareness, empathy, and openness make a significant impact on the client's comfort, dignity, and safety. Understanding the role of listening. Why listening matters. Listening is more than hearing someone speak. It's about fully receiving, processing, and responding to what they say. Clients often communicate their needs, discomforts, or emotions subtly, and attentive listening helps you understand them better. Active listening behaviors. To show you are listening, make eye contact when culturally appropriate. Nod occasionally or say short affirmations like, "I understand," or "Okay." Avoid interrupting. Wait before responding to allow the speaker to finish. Paraphrase or summarize to confirm. For example, so you're saying, benefits of good listening. Builds trust and rapport. Helps catch early signs of illness or distress. Improves client satisfaction. Reduces misunderstandings and errors. Barriers to good listening. Common challenges. Being distracted or thinking about your next task. Assuming what the client means instead of clarifying. Using technical language that the client may not understand. Interrupting or finishing their sentences. How to overcome these barriers. Focus on the present moment. Create a quiet environment when possible. Avoid multitasking during conversations. Practice patience. Some clients may need time to express themselves. Introduction to cultural sensitivity. What is culture? Culture includes a person's language, traditions, religion or spirituality, beliefs about health, illness, family roles, and daily routines. Understanding cultural backgrounds helps you deliver care that respects each client's values and preferences. Why cultural awareness is important. Prevents misunderstandings. Shows respect for clients' identities. Encourages open communication. Reduces conflict and discomfort. Respecting cultural differences in the home. Practical ways to show respect. Ask, do you have any personal or cultural preferences I should know about? Follow traditional meal guidelines, such as avoiding certain foods. Respect preferences for modesty or same-gender care. Allow time for prayer or rituals if part of the client's routine. Common cultural considerations. Area. Eye contact. Examples. In some cultures, direct eye contact may be seen as rude or aggressive. Touch. Physical touch may be limited or gender-specific. Decision-making. Some clients defer decisions to family or community elders. Pain expression. Some may underreport pain due to cultural beliefs of strength or endurance. Always ask questions kindly and never assume every individual is unique, even within a cultural group. Language barriers and communication tips. If English is not the client's first language, speak slowly and clearly without shouting. Use simple words and avoid medical jargon. Point to objects or use visual aids when needed. Be patient. Give them time to think and respond. When to use interpreters. If important health information is being discussed, when safety instructions or care tasks need to be clearly understood, follow agency guidelines. Never use children or other clients as interpreters. Building trust through empathy and acceptance. Be open-minded. You don't have to share someone's culture or beliefs to respect them. Ask questions respectfully and show a willingness to learn. Practice empathy. Try to understand the client's point of view. Statements like, "I can imagine that's important to you. Tell me more about how you usually do things." These help clients feel heard and supported. Being a great home health aide means more than completing care tasks. It's about connecting. By listening actively and respecting cultural differences, you honor your client's dignity and improve the quality of their care experience. Always approach communication with kindness, patience, and curiosity. Your respectful presence in their home can create comfort, trust, and a true sense of safety. Being a great home health aide is about more than tasks, it's about connection. By listening with patience and respect, you build trust, honor dignity, and create a safe, comforting care environment. Handling difficult behaviors professionally. Home health aides, HHAs, often care for individuals who may be experiencing pain, confusion, fear, or frustration. These emotions can sometimes result in challenging behaviors like aggression, refusal of care, or verbal outbursts. This lesson teaches how to handle such behaviors with calm, professionalism, and empathy, ensuring both client safety and the HHA's own well-being. By the end of this lesson, learners will know how to identify common difficult behaviors, de-escalate tense situations, maintain professional boundaries, and respond in ways that prioritize dignity and safety. Recognizing difficult behaviors. Common behaviors you may encounter. Verbal aggression, for example, yelling, name-calling. Physical aggression, for example, hitting, kicking. Wandering or restlessness. Refusal of care, crying or emotional outbursts. Inappropriate sexual behavior. Repetitive questions or behaviors, especially in dementia clients. Possible causes. These behaviors are not personal attacks, but often symptoms of pain or discomfort, fear or confusion, especially in cognitive impairment, mental health conditions, medication side effects, lack of control over their environment or body. Understanding the why behind a behavior helps guide your response. Responding with professionalism. General principles. Stay calm and composed. Speak softly and slowly. Use non-threatening body language. Avoid arguing or raising your voice. Give the client space and time to express themselves. Key do's. Acknowledge feelings. I can see you're upset. Redirect gently. Let's go sit down and talk. Maintain personal safety. Keep exits open and stay alert. Get help if needed. Contact a supervisor or nurse in unsafe situations. Key don'ts. Don't argue, punish, or confront the client harshly. Don't take the behavior personally. Don't ignore threats to safety. Always report serious incidents. De-escalation techniques. Strategies to calm a situation. Lower your voice. It helps reduce tension. Use the client's name. It brings familiarity and focus. Offer choices. Example, would you like to sit now or later? Empathize. A simple, I understand this is hard, can ease frustration. Step back if needed. Take a brief break to allow emotions to settle. Creating a calm environment. Reduce noise and stimulation. Ensure good lighting and temperature. Remove items that could be dangerous. Refusal of care. What to do? Clients have the right to refuse care, but HHAs must document and report this professionally. How to handle refusals. Don't force care. Ask why they don't want help. Try offering another time or a different caregiver. Use positive language. Let's try washing your hands now to feel fresh. Always notify your supervisor if the refusal affects safety or health, e.g., skipping meals, medications, hygiene. Handling aggression or unsafe behavior. In case of physical aggression, protect yourself, never engage physically. Back away slowly. Use a calm tone. Avoid cornering the client. Call for help or follow your agency's emergency protocol. Inappropriate sexual behavior. Stay calm, not confrontational. Say, "That behavior is not appropriate," in a firm but respectful tone. Report all incidents to your supervisor immediately. This may be a sign of a medical condition like dementia, medication effects, or a psychological issue, not necessarily an intentional action. Boundaries and emotional self-care. Maintain professional boundaries. Be friendly, not personal. Don't share personal problems. Don't tolerate repeated abuse. Report it. Take care of yourself. Talk to your supervisor or team when you feel stressed. Take short mental breaks if overwhelmed. Practice breathing exercises or relaxation techniques. You can't give your best care if you're burned out or emotionally drained. Handling difficult behaviors is one of the more sensitive and demanding parts of being a home health aide. It requires patience, professionalism, empathy, and safety awareness. By staying calm, using de-escalation skills, and maintaining boundaries, HHAs can provide dignified, compassionate care. When in doubt, always seek help and document appropriately. Your safety and your client's well-being depend on it. Handling difficult behaviors takes patience, empathy, and professionalism. By staying calm, setting boundaries, and seeking help when needed, you ensure safe, respectful, and compassionate care for every client.
Reporting changes in condition. As a home health aide, HHA, you are often the first person to notice subtle changes in a client's physical or emotional condition. Recognizing and reporting these changes promptly can make a critical difference in preventing serious complications or hospitalization. In this lesson, we'll explore what signs to watch for, how to document them accurately, and how to communicate them effectively to your supervisor or care team. This lesson is designed to build your confidence in being a reliable, professional observer and communicator, an essential part of every client's healthcare team. Understanding why reporting matters. Why it's important. Clients receiving home care are often medically fragile or elderly. Even minor changes may signal serious health issues. Early detection allows quick intervention and better outcomes. HHAs are the eyes and ears for nurses, doctors, and family members. The role of the HHA. Observe the client regularly. Recognize new or unusual symptoms. Report observations promptly. Record details clearly and accurately. You are not diagnosing, you are noticing and reporting. What to observe. Physical changes to watch for. Vital signs. Unusual temperature. Rapid pulse. Irregular breathing. Skin color or condition. Pale, flushed, blue, cold, clammy, rashes, bruises. Mobility. Sudden difficulty walking, weakness, falls. Appetite or elimination. Loss of appetite, nausea, vomiting, diarrhea, constipation. Swelling or pain, especially in feet, hands, or around wounds. Bleeding or unusual discharge from any body area. Shortness of breath, chest pain, or difficulty speaking. Emotional and behavioral signs. Confusion or memory changes. Mood swings or withdrawal. Agitation or aggression. Depression or crying spells. Environmental clues. Changes in sleeping patterns. Unusual odors. Could signal infection or hygiene issues. Unsafe living conditions. Clutter, lack of food, hazards. How to report effectively. Use the what, when, where method. What did you observe? For example, Client complained of chest pain. When did it happen? For example, this began at 10:30 a.m. Where is it located or happening? For example, pain is on the left side of the chest. Report immediately if the change is sudden or severe, fall, stroke symptoms, bleeding. The client appears to be in distress or pain. The client expresses suicidal thoughts or confusion. Routine changes. If the change is minor or not urgent, report it by the end of your shift. Examples: decreased appetite, mild swelling, low energy. Use objective language. Say, client vomited twice after breakfast. Not, client looks sick. Stick to what you see, hear, or measure, not opinions or guesses. Documentation basics. What to include in written notes. Date and time. Exact observation. Signs, symptoms. Actions taken, e.g., reported to supervisor. Client response, e.g., rested after vomiting. Your initials or signature. Always follow your agency's specific documentation format and protocols. Do's and don'ts. Do write clearly and neatly. Do use black or blue ink, if paper-based. Do be honest and accurate. Don't use correction fluid or erase mistakes. Don't document before care is given. If you make an error, draw one line through it, write error, and initial it. Chain of communication. Who to report to. Usually your immediate supervisor or nurse. Follow your agency's reporting protocol. If unsure, ask who to notify. When in doubt, speak up. It's better to report a concern that turns out to be minor than to miss something important. Home health aides play a critical role in monitoring and protecting client health, staying alert to changes, documenting clearly, and reporting promptly helps prevent emergencies and improve quality of life. This lesson gave tools to recognize when something isn't right and take the right steps to ensure client safety. Keep observing, stay professional, and remember, you're a vital part of the care team. As a home health aide, your attention to changes can protect lives. By observing closely, documenting clearly, and reporting quickly, you help ensure safety and quality care every day. Client privacy, confidentiality, and HIPAA. Respecting a client's privacy and protecting their personal information are not just ethical responsibilities, they are legal requirements. As a home health aide, you are entrusted with access to private health and personal information. This lesson will teach you how to handle that responsibility professionally and in compliance with federal law, specifically the Health Insurance Portability and Accountability Act. This lesson focuses on understanding what privacy and confidentiality mean, how HIPAA affects your daily work, and what actions are required to stay compliant and trustworthy. Understanding privacy and confidentiality. What is privacy? Privacy refers to a person's right to control who sees or knows about their body, belongings, and personal life. Examples in home care. Ensuring doors are closed during bathing. Not talking about the client's health around others. Respecting their decision to refuse care. What is confidentiality? Confidentiality means keeping private information private, especially medical and personal details. Examples: not sharing medical diagnoses with unauthorized persons, not discussing client conditions with neighbors or other clients, avoiding gossip or careless conversations, These are basic human rights that also align with professional and legal standards. Introduction to HIPAA. What is HIPAA? HIPAA stands for the Health Insurance Portability and Accountability Act. It is a federal law passed in 1996 to protect sensitive patient health information from being disclosed without the patient's knowledge or consent. Why it matters. HIPAA applies to all healthcare workers, including HHAs. Violating HIPAA can result in legal action, fines, or job loss. Clients trust HHAs with their health information. Protected Health Information, PHI. HIPAA covers PHI, or Protected Health Information, which includes medical records, diagnoses, test results, health insurance information, anything that identifies the client, name, address, date of birth. Guidelines for protecting PHI. Do. Share information only with authorized healthcare team members. Store written records in a locked or secure area. Log out of digital systems when finished. Speak quietly when discussing client information. Do not. Leave records out where others can see. Share client information over the phone unless verified. Talk about the client in public or with unauthorized people. Text or email client information using personal devices. Phone example. If a family member calls and asks for the client's medical update, you must confirm they are authorized. Direct them to the supervisor if unsure. Never disclose details over the phone without permission. Applying privacy principles in the home. Respecting physical privacy. Knock before entering a room. Drape or cover the client during bathing or procedures. Provide privacy during toileting and dressing. Avoiding casual violations. Don't talk about one client with another. Avoid posting about work on social media. Never take photos or videos of the client, even if they say it's okay. Remember, intent doesn't matter. If the action violates HIPAA or the client's dignity, it's wrong. What to do if privacy is breached. If you make a mistake, report the breach to your supervisor immediately. Do not try to hide the error. If you witness a breach, speak with your supervisor. Document what happened factually. Handling violations properly helps maintain a culture of safety and professionalism. As an HHA, you are expected to be both compassionate and legally responsible when handling client information. Respecting privacy, protecting confidentiality, and understanding HIPAA are essential parts of your job. Even simple acts, like closing a door or keeping records secure, can have a major impact on client dignity and trust. By mastering these principles, you'll not only follow the law, but also support the emotional well-being of those you care for. Legal responsibilities of an HHA. As a home health aide, HHA, you are not only a caregiver, but also a responsible professional held to specific legal standards. Every task you perform must be guided by a clear understanding of your legal duties and boundaries. This lesson explains the key legal responsibilities HHAs must follow, including scope of practice, mandatory reporting, proper documentation, and legal consequences of misconduct. Whether working under a registered nurse or a home health agency, your role comes with legal accountability. Let's explore what that means in everyday practice. Understanding scope of practice. What is scope of practice? Your scope of practice defines what you are legally allowed to do in your role as a home health aide. It is based on your training, certification, and the state regulations you work under. What you can do. Assist with personal hygiene, bathing, grooming, toileting. Help clients move or transfer safely. Take vital signs as directed. Report changes in the client's condition to a supervisor. Perform light housekeeping and meal prep. Follow the care plan designed by a nurse or healthcare provider. What you cannot do. Give medications unless allowed under state law and properly trained. Insert or remove tubes, catheters, feeding tubes. Change sterile dressings. Make medical diagnoses or decisions. Modify a care plan. Working outside your scope is illegal and dangerous. Legal concepts every HHA should know. Negligence. Negligence means failing to act with reasonable care leading to harm. For example, forgetting to lock a wheelchair before a transfer and the client falls. Abuse. Abuse is intentional harm or mistreatment of a client. This includes physical, emotional, verbal, financial, or sexual abuse. It is a criminal offense. Abandonment. Abandonment happens when an HHA leaves a client without proper notice or coverage, especially during a scheduled visit. This is a serious legal violation. Assault and battery. Assault. Threatening to touch or harm a client. Battery. Actually touching the client without permission. Example, forcing care. Getting informed consent before providing care is essential. Documentation responsibilities. Why documentation matters. Accurate documentation protects. The client ensures safe care. The agency, legal protection. You, proof of work performed. Best practices. Use black or blue ink. Write clearly and legibly. Never erase. Cross out with one line, write error, and initial it. Include date, time, and your initials. Be factual. Do not include opinions. What to record. Vital signs, if assigned. Food and fluid intake. Elimination patterns. Mobility changes. Any unusual signs or behaviors. Client complaints or refusals. Mandatory reporting duties. As an HHA, you are a mandated reporter. This means you are legally required to report. Suspected abuse or neglect. Unsafe home conditions. Any sudden changes in client health or mood. Who to report to. Your supervisor or nurse. Adult Protective Services, as directed. Emergency services if immediate danger. Most important tip. Report even if you are not 100% sure. Better to alert someone than risk harm to the client. Legal liability and professionalism. Protecting yourself. Always follow the care plan. Ask for clarification if unsure. Stay within your scope. Don't perform tasks you haven't been trained for. Keep everything confidential, but report when required. Consequences of legal violations. Job loss, fines, loss of certification, criminal charges, in cases of abuse, theft, or serious neglect. Being professional means knowing the law and respecting it every day on the job. Legal responsibility is not just paperwork. It's the foundation of safe, respectful, and ethical care. As a home health aide, you are responsible for staying within your scope, following the care plan, documenting properly, and reporting concerns immediately. Understanding and honoring these responsibilities helps protect the clients you serve and protects you as a professional. When in doubt, always ask, report, and document. Your role carries both privilege and responsibility. By staying true to your professional duties, you ensure safety, dignity, and trust. Keep learning, stay vigilant, and always lead with integrity, because the care you give today shapes the lives you touch tomorrow. Abuse, neglect, and mandatory reporting. As a home health aide, you are a trusted caregiver in your client's life. With this role comes the serious responsibility of recognizing and preventing any form of abuse or neglect, and reporting it when necessary. This lesson will teach you how to identify abuse and neglect, understand the signs and symptoms, and carry out your legal and ethical duty to report these issues. Your prompt action can save a life, protect a vulnerable individual, and fulfill the ethical standards of your role. Let's begin. Understanding abuse. What is abuse? Abuse is any intentional act that causes harm or serious risk of harm to a vulnerable person. It can be physical, emotional, sexual, financial, or verbal in nature. Types of abuse. Physical abuse. Hitting, slapping, pushing, burning, or restraining. Signs: unexplained bruises, fractures, fear of caregiver. Emotional, psychological abuse. Threats, insults, yelling, intimidation, humiliation. Signs: withdrawal, fear, depression, low self-esteem. Sexual abuse. Non-consensual sexual contact, inappropriate touching or comments. Signs: bruising in genital areas, panic when touched, STIs. Financial abuse. Stealing money, forging checks, misusing credit cards or benefits. Signs: sudden bank account changes, unpaid bills, missing valuables. Verbal abuse. Name-calling, threats, manipulation, or derogatory language. Signs: emotional distress, crying, low mood after conversations. Abuse may be committed by family members, other caregivers, or even professionals. Understanding neglect. What is neglect? Neglect occurs when a caregiver fails to provide the necessary care, resulting in harm or risk of harm to the client. It may be intentional or due to lack of training or attention. Types of neglect. Physical neglect. Not assisting with hygiene, nutrition, or safety. Example: leaving a client in soiled linens for hours. Medical neglect. Failing to provide access to medications, treatments, or appointments. Example: ignoring instructions to monitor blood sugar. Emotional neglect. Ignoring the client's need for interaction or reassurance. Example: not responding when the client expresses pain or fear. Signs of neglect: weight loss, dehydration, pressure sores, poor hygiene, unsafe home environment, isolation and loneliness. Neglect is just as serious as abuse and must be reported immediately. Legal requirement. Mandatory reporting. Who is a mandated reporter? As an HHA, you are a mandated reporter. This means you are legally required to report any suspected abuse or neglect of a client, even if you are not completely sure. You do not need proof, just reasonable suspicion is enough. Who to report to? Your immediate supervisor or agency nurse. Adult Protective Services, APS. Emergency Services, 911, if the client is in immediate danger. What to include in a report: client's name and location, description of suspected abuse, neglect, your observations, what you saw or heard, names of suspected abusers, if known, time and date of incident or discovery. Do not delay. Report immediately and document your actions. Protecting the client and yourself. Steps to take if you suspect abuse or neglect. Ensure the client is safe. Call 911 if necessary. Report the incident to your supervisor or the proper agency. Do not confront the abuser. Document everything factually and clearly. What not to do. Don't wait for proof. Don't investigate yourself. Don't ignore signs. Don't gossip about the situation. Your role is to observe, report, and protect, not to judge or intervene directly unless safety is at stake. Building trust and preventing abuse. How HHAs help prevent abuse. Treat clients with respect and dignity. Promote client independence as much as possible. Observe and report changes in mood, behavior, or physical condition. Communicate openly and compassionately. Support the client's right to privacy and autonomy. Creating a safe, respectful environment reduces the risk of both abuse and neglect. Abuse and neglect have no place in home care. You are on the front line of defense for vulnerable clients. Understanding what abuse and neglect look like and taking immediate action to report them is a vital part of your professional role. You are the client's advocate, and fulfilling your legal duty to report helps protect their rights, safety, and dignity. When in doubt, speak up. Your voice matters. You are the client's advocate. By speaking up, you protect their safety, dignity, and rights. When in doubt, act. Your voice can change a life.
Promoting dignity, independence, and rights. In home care, clients are not just patients. They are individuals with personal histories, preferences, rights, and goals. As a home health aide, HHA, your role extends beyond providing physical care. You are responsible for supporting your clients' dignity, encouraging their independence, and upholding their basic human rights every day. This lesson will walk you through what it means to promote dignity, foster independence, and protect client rights in home care settings. When these values are honored, the quality of care and the quality of life both improve. Promoting dignity in daily care. What is dignity? Dignity means treating each person with respect, honor, and value, regardless of age, illness, or limitations. Dignity is a fundamental human right and is central to ethical caregiving. Practical ways to promote dignity. Use the client's preferred name and title. Always ask how the client wishes to be addressed. Provide privacy during personal care. Knock before entering. Close doors. Cover the client when bathing or dressing. Listen actively. Make eye contact, show empathy, and validate feelings. Be patient. Allow the client to speak or move at their own pace. Avoid baby talk or condescending language. Speak to the client as an adult and with professionalism. Respect personal belongings and space. Ask before moving items and treat their home with care. Why it matters. When clients feel respected, they are more likely to engage positively in their care and feel valued as individuals, not just as care recipients. Supporting client independence. What is independence? Independence is the ability to make decisions and perform activities of daily living, ADLs, with minimal assistance. Even small tasks like choosing clothing or brushing hair can foster a sense of control. Strategies to encourage independence. Encourage, don't rush. Allow clients time to attempt tasks on their own, even if it takes longer. Offer choices. Let the client choose their meals, clothes, or activity schedule. Provide appropriate tools or modifications. Use adaptive utensils, walkers, or grab bars to enable more self-care. Teach, don't take over. Guide the client through steps instead of doing it for them. Celebrate successes. Praise small achievements to boost confidence and motivation. Key principle. Promoting independence is not about doing less. It's about empowering the client to do more for themselves. Upholding client rights. Understanding client rights. Clients in home care have legal and ethical rights that must be honored at all times. These rights are designed to protect their autonomy, safety, and quality of life. Core client rights include the right to be treated with dignity and respect, the right to privacy and confidentiality, the right to make choices about care, the right to be free from abuse, neglect, and restraint, the right to participate in their care planning, the right to voice complaints without fear of retaliation. HHA responsibilities. Know and follow your agency's policies on client rights. Advocate for the client if rights are not being honored. Educate clients about their rights if they are unaware. Report any violations or concerns to your supervisor. Respecting these rights not only protects the client, it builds trust and promotes ethical care. Honoring cultural, personal, and religious values. Why this matters. Every client brings a unique background, including culture, religion, language, and personal beliefs. Dignity and rights include respecting these differences without judgment. Examples of respectful care: preparing foods the client is allowed to eat based on religious practices, observing prayer times or cultural holidays, using preferred language or interpreter services, adapting care to align with personal modesty or grooming preferences. Avoid imposing your own values, dismissing cultural beliefs, ignoring spiritual needs. Always ask, never assume. Promoting dignity, independence, and rights is at the heart of compassionate home care. As a home health aide, you are in a powerful position to make your client feel respected, capable, and safe. By supporting client choices, encouraging small acts of independence, and upholding their legal rights, you not only fulfill your role, you enrich their life. When you lead with kindness and respect, your care makes a lasting difference.